Thanks.
Okay, Madam Chair.
Thank you. Good morning, everyone. It's 9:05 in the morning on October 27th, and I'd like to call this meeting of the Texas Behavioral Executive Council to order. Daryl, could you start with roll call, please?
Sure. Before we do that, Madam Chair, let me make sure we can hear everybody. I know Mr. Francis may be having some difficulty.
Oh, I see that. Yes. There you go.
Daryl, can you hear me?
Yes, sir.
Okay, thank you very much. We're good on the sound then.
Okay. Dr. Taylor?
I'm here, just having some technical difficulties.
Okay.
Non-technical related.
Okay. Okay, Madam Chair, what did you ask us?
Did you want to call roll?
Sure.
Thank you.
Gloria Canseco?
Present.
Dr. Ken Bateman?
Present.
Mr. John Blemowitz?
Present.
Mr. Tim Brown?
Present.
Dr. Susan Fletcher?
Present.
Mr. George Francis?
Present.
Mr. Stephen Hallbauer?
Present.
Mr. Ben Morris?
Present.
Dr. Chris Taylor?
Present.
You got a quorum, ma'am. All council members are present.
Thank you and good morning. I'd like to welcome 3 new members and to bid a fond farewell to the folks they've replaced. Dr. Christopher Taylor, replacing Steve Christofferson from the Licensed Professional Counsel Board. Welcome.
Thank you, Madam Chair. It is a pleasure to be here, and it is sad to see Steve go.
Thank you. Dr. Stephen Hallbauer, did I say that right?
Hallbauer, and
Hallbauer.
It's Hallbauer, and I'm not actually a doctor. I'm an attorney. I'm a public member with Lpc board, but thank you for having me today.
Sure. And technically JD is a lawyer, so we'll count. I mean, he's a doctor, so we'll count that.
But technically, but if somebody breaks an arm, I'm not.
We won't call you. And then Dr. Ken Bateman, replacing Jennifer Smotherman, professional member from the Board for Licensed Marriage and Family Therapists. Welcome, Dr. Bateman.
Thank you. It's an honor to be here.
Thank you. We need to review item 3. I'm sorry, I was supposed to say there's a quorum present, and we need to review and approve the minutes from the prior meeting. I trust everyone received them in their package, including the one sent this morning with a slight change.
Chairwoman, I received it and I make a motion to approve the minutes as sent.
Thank you, Mr. Francis.
I'll second it.
I have moved and seconded to approve the minutes as submitted. All in favor, please indicate by saying aye.
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 All right.
Any opposed, same sign. The motion passes. We'll move on to item 4, which is a discussion whether to initiate rulemaking to adopt non-discrimination requirements for licensees, or alternatively to seek the Attorney General's opinion regarding the agency's authority to initiate rulemaking under the current statutory authority. We'll have some discussion, but I'd like to make a statement and then call on Tim Brown in his role as president of the Licensed Social Workers Board. And then we have a legislator here, Senator Menendez, welcome. And we'll follow with his remarks before we continue. First and foremost, I'd like to apologize to the members of the public for the anguish caused by actions of the council, perceived as hostile to the LGBTQ+ community or to disabled persons. As we made clear during the Q&A items in the October 12th meeting, the council immediately responded to public comment. We're deeply thankful to those who listened, heard, and supported our intent to rectify the issue that people brought forward despite the media distortion that followed. We're equally thankful for those who expressed outrage, since after all, our country was founded on principles of equality under the law. But thanks to you who spoke up, and then all of you whose comments followed, No fewer than 3 strategies have been identified to address this matter. This is how a democracy works, and we are genuinely grateful for the partnership of our shareholders, and thank you so much for your input. And naturally, it's been a difficult 2 weeks, not only for stakeholders, but for those of us who are members of the council, staff members, and potentially the public at large. As difficult as that's been, the adversities presented us with an opportunity to identify a gap in statutory language. So we thank you for that. That's how democracy should work. Assuming the statutes prohibit discrimination, sorry, I wrote this because I won't remember. Assuming that statutes that prohibit discrimination based on sex are at the very least 20 years old, and although this council is not authorized to change statutory law, we can certainly bring the outdated language to the attention of our legislators. In fact, since this language applied uniquely to social workers, we have an opportunity to clarify the language, or at least to request clarification of the language for every profession that falls under the council's regulatory authority. I think I speak for everyone in the former council and all of our new members when we say that we have no intention of discriminating for any reason against any person. That's not who we are as a country. That's not who we are as a state. And it's certainly not who we are as a council. So I thank you for your indulgence and for allowing me to make that statement. I'd like to invite Tim Brown, who's a member of our council and president of the Social Workers Board, to make his remarks. Tim?
Thank you, Chair Canseco. I appreciate the opportunity to address to everyone who is attending the meeting live, and for those individuals who may listen to this in recording in the future. Again, I'd like to stress, like Chair Canseco, I want everyone to know that no member of the Texas State Board of Social Worker Examiners, whether a public member or a professional member, promotes the discrimination of any person who is part of our LGBT plus family, persons living with disabilities family, or any other member of our citizenry. We're opposed to any form of discrimination. This position, as shared by Chair Canseco, is also the position of the Behavioral Health Council. As a human being and as a social worker who has practiced for 28 years, has been a member of the National Association of Social Workers since 1992, and who adheres to the NASW Code of Ethics, I understand why emotions are high. Finding ourselves in a situation of high emotions, some have turned to personal attacks, such as speaking out negatively against Texas State Board of Social Worker board members, the Texas State Board of Social Worker Examiners Executive Director, and members of the Behavioral Health Council. For example, one has sent a postcard calling a member of the Social Work Board a coward. And another person has sent a letter to another board member with a veiled death threat. Many have cited the NASW Code of Ethics, which I believe in and work hard to incorporate into my social work practice and my daily life. So I would ask you, in citing the NASW Code of Ethics, also consider Section 2, where social workers' ethical responsibilities to colleagues, such as 2.01, talking about respect. Social workers treat colleagues with respect, and social workers should avoid unwarranted negative criticism of colleagues. If you are not in the shoes of a social work peer and have not had all the details of the situation explained to you, consider finding out more information of what occurred. I'm not against advocating. I just constantly request that avocation be in a manner that is respectful to others. On a daily basis, I advocate for my clients, for my staff, and community organizations where I volunteer my time. On the flip side, I've been fortunate, and I hope other members of the social work have been fortunate, that some social workers have reached out to us expressing concerns for our well-being and saying that they understand there's more to the situation that's been presented publicly. We've been fortunate to receive outreach from people from all across North America, Europe, and even one individual from Australia. In 2010, 2011, 2013, as the chair of the Texas State Board of Social Worker Examiners, I worked with representatives of the NASW Texas chapter to adjust our code of conduct. Vicki Hansen, who was the executive director of NASW Texas at the time, Paula Bulls, a member of the NASW Texas chapter, and Josephine Titsworth, another member of the NASW Texas chapter, approached me and the Texas State Board of Social Worker Examiners requesting that we adjust our rule 781.201, which is our code of conduct. Over the time period, I worked with all three, as well as the Texas State Board of Social Work Examiners board members, to add the words sexual orientation, gender expression, and gender identity. It's because of the avocation of Josephine, Paula, and Vicki that these additional words were added and the information came to fruition. I'm sure that each of us have experienced within our lives where we're stuck in the proverbial rock in a hard place. You found yourself provided information which you believe is the best information out there and the information that you should adhere to at the time. And we, as the Texas State Board of Social Worker Examiners, and then the Behavioral Health Executive Council members, found ourselves there on October the 12th. Through sharing of others, some have said, I would have never voted that way, or I would have stormed out of the meeting. A few have suggested that the social work professional members should have ethics charges brought against them or have their license revoked. Let me share with you, when you're in the moment and you have few choices, you make the best decision you can. And I'd like to share an analogy with you. Say you have a deep severed wound and it's bandaged. You know, the kind where you have layers of bandage and the top layer or covering of the wound has adhered to the bandage. You know you have to change the bandage. You know you have to do that to apply antibiotics to help heal the wound. And so no matter what you do, you know when you pull that bandage off, there's going to be pain and hurt. For better or worse, you have to pull the bandage off. And that is what we did. Many have reached out to me and suggested that there was overstepping on part of the review process and that there are violations of Open Meetings Act. There's suggestions that there have been violation of the Texas Procedural Act. There have been suggestions that duty and responsibility to rules fall strictly onto the social work board concerning social work practice, code of conducts, and ethics. And there have been many, many other suggestions. But those at the time when we were in the midst of making decisions were not brought to the forefront, and not all are our purview of examining whether something is right or wrong. That is done by another entity, our council, and help advise us as we go through processes. As Chair Canseco shared, the last 2 weeks have been difficult for many, including the social work board members and the BHEC council members. The right way or the wrong way, again, we rip the bandage off to allow healing to start. I'd like to end my sharing with the reiteration that everyone once again know, no member of the social work board and no member of the Behavioral Health Council condone in any way the discrimination of persons who are living with disabilities or persons of the LGBT plus community, specifically the words of sexual orientation, gender expression, or gender identity. So I call upon everyone to now let the healing begin, and let's start processes of figuring out how to work with our current situation. Thank you, Chair Canseco, for affording me this time and allowing me to speak. And thank you to those who are turned in for giving me a few moments of your time to help consider other possibilities. Thank you.
Thank you so much. As I mentioned, this council has identified at least 3 strategies that may address this, but we are not permitted to change statutory language. And I'd like to reiterate, at no time do we, at every opportunity, our intent is to prohibit discrimination against any person for any reason. I'd like to recognize Senator Jose Menendez from San Antonio, who'd like to offer a testimonial, and I realize that his time is precious, so I will call on him before proceeding with the rest of item 4. Senator Menendez, thank you for being here with us.
Thank you, Madam Chair. Can you hear me?
Yes.
Thank you very much. I appreciate the opportunity to testify before you and your board today, and so many who have tuned in. As we all know, and we've heard nearly 2 weeks ago, the council voted to change the Texas State Board of Social Work Examiners Code of Conduct. In my opinion, the change was not necessary. And on its face, there's obviously no other way to take it, but that this change opens the door for the possibility of discrimination. And regardless of what the intentions may or may not be. And the council removed what I believe are necessary protections to serve individuals on the basis of their disability, sexual orientation, gender identity, or expression. So what I want to emphasize today is that this change can open the door for social workers. And I know that 99.9% of all social workers would not discriminate, never have it in their heart. It's not why they go into that profession. But the problem is that by taking this away, then it would allow someone somewhere to discriminate against someone who may be in a very vulnerable position. Over 100 of our Texas counties currently, many in rural areas, already have a shortage of social workers and other mental health professionals. In my opinion, this policy change, unnecessary as it is, would impact the LGBTQI community plus and disabled clients' access to mental health services in those areas and beyond. It would detrimentally affect those who are already at risk for high trauma and take away access to their mental health resources. Potentially, but that is still too great a risk for me. For many of these individuals are sometimes already at their lowest points, trying to seek help, and a social worker who is supposed to be in a position to help them and support them during a trying time, with this policy change, would have the ability to simply say no. If a person would like the ability to refuse services to some of our most vulnerable in their time of need, in my opinion, they've chosen the wrong profession. I believe no medical professional of any kind should be allowed to discriminate against a person based on who they are, plain and simple, for any reason. So quite frankly, I believe that this change made without public input, based on my experiences and my conversations and what I have heard, I don't believe that the majority of social workers want this change. So I think that this would be affirmed. I believe it will be affirmed in the testimony you will hear today. I've had a great honor to work alongside many, many of our advocates who are yearning for you all to rescind your vote and restore the protections to our most vulnerable. Social workers, as you all know, are meant to help and provide care to those who most need it, not to blatantly discriminate or disregard a person who's in need. So we must ensure that our most vulnerable Texans have access to proper and needed mental health, and that social workers provide. And when it comes to the health of any Texans, we should be prioritizing their needs, not encouraging, or not necessarily encouraging, but even providing a license or an ability to discriminate and take away and create any situation for intolerance in any community. I want to be very clear in my testimony. There is no place in this state for discrimination. And I believe the two, you, Ms. Canseco and Mr. Brown, that you don't have that in your heart. So this is why I'm requesting all of you in this council not to move forward to adopt these discriminatory changes and to restore the protections that the Texas State Board of Social Workers Code, Examiners Code. I'm also urging the council to truly listen to the public testimony that will be taking place today. And as I've mentioned before, Texans, my constituents, the million people that live within Senate District 26, the majority do not support this change. Overwhelming majority. Social workers themselves are very upset with these changes, and they find that the original code was necessary for the profession itself. Otherwise, why would those words have been put there in the first place? So I understand the words that came from Mr. Brown about the proverbial rock in a hard place. But I also know that leadership is many times difficult. And sometimes when you're put in a position of leadership, it can be a very lonely place. And at times you're put in a position where you're being asked to do something that you have to sometimes push back. And you have to give up. And at the end of the day, every one of us, every morning, have to look at ourselves in the mirror and know and live with the decisions that we make. So I hope that today you'll stand on the right side of history and restore these protections and know that the cavalry is coming. When the next legislative session comes into place, I will be, as a matter of fact, I will be looking to file legislation as soon as the day after the election to make sure that we not only don't ever have a license or give someone the ability to potentially discriminate, but make sure that people know that discrimination is not allowed and not supported in any way, shape, or form in the state of Texas. I can't even begin to imagine a young person calling into a hotline, potentially thinking about harming themselves and being told, "I'm so sorry, I can't help someone like you." I know that y'all don't have this in your heart. Push back against whatever lawyer is telling you you have to do this. Whoever the person is, tell them no. Tell them you make the change. Find someone else. Thank you for your time. I appreciate your service to the state of Texas, and I hope and pray that you do the right thing. Thank you, Madam Chair.
Thank you, Senator. And I hope that if we can lean on you for clarity with regard to sex discrimination, which I guess was passed, I want to think in the 70s or defined in the 70s. Perhaps
You can rely on me for anything y'all need to improve social workers' work and the way that we help Texans in the state of Texas.
Thank you.
We
so
need more
much.
of you. Absolutely. Thank you.
Thanks for taking the time to be here today.
Thank you for having me. Appreciate you.
All right, so we need to look at our 3 strategies.
Madam Chair,
Yes.
we also have Representative Jessica Gonzalez who had
Oh, I'm
asked
so
to.
sorry.
Let me
see
bring
on
her.
the screen. Sure, of course, Representative Gonzalez, thank you for being here. I didn't realize you were present.
Morning. Can everyone hear me okay?
Yes, ma'am.
Yes, we can.
Good morning. Again, I'm State Representative Jessica Gonzalez from Dallas. I'm also a co-founder and vice chair of the Texas House LGBTQ Caucus. I want to thank the Texas Behavioral Health Executive Council for reconsidering the recent changes to the Texas State Board of Social Worker Examiners Code of Conduct and allowing me to testify before council today. I'm here today because as a member of the LGBTQ community, this is the latest reminder of a series of reminders that unfortunately I know all too well. It's about reminding those of us who have never belonged not to get too comfortable because despite our achievements, our character, our commitment to our families and to serve our community, there are people in power who want us to know that at any time someone can refuse to serve us, that someone can refuse to see us. There are at least 1 million LGBTQ Texans. We have families, spouses, children, just like everyone else in our state. We work hard, we pay our taxes, we work to take care of our families and to make our state a better place. So why should our families and families of those with disabilities be singled out for discrimination? It's wrong, and the majority of Texans agree that discrimination of any kind is not acceptable. But here we are again, another attempt to create two classes of Texans. Those who are trying to get an education, make a living, support their family, and those with power to deprive them of their dignity in their everyday life. I'd like to share a personal story with you guys here that I don't share too often. I was outed when I was in high school, and it was a very difficult time for me. I was bullied, I was rejected, and I faced discrimination. And I consider myself lucky to be here with you today, and that my story didn't end in a travesty, like many other children's have. I'm standing here today because I want to make sure this doesn't happen to another generation of Texas children. I'm here because I don't want a single child in the state of Texas to go through what I went through when I was in high school. I don't want any Texas child to feel desperate and alone and not have professionals like social workers to turn to when they may be contemplating their own existence. The move by the governor's office to allow social workers to discriminate based on a disability or sexual orientation or gender identity is wrong. The code change undermines the very foundation on which social work is built upon. And my top priority is to make sure that we put an end to these types of actions. I respectfully ask the council to reconsider and reinstate the protections for disabled individuals and the LGBT community. We must continue to stand up for all disabled and LGBTQ individuals' rights in Texas until protections are codified into state law. That's why I'm planning on filing a bipartisan, comprehensive LGBTQ inclusive non-discrimination bill in the next legislative session. This legislation would send a powerful message to the LGBTQ community, and especially our young people, that Texas sees them, that values and recognizes them for who they are, that they have a place here, and that their dignity is not up for debate. So I urge council to send that same message to all young LGBTQ Texans today, that we value them and that we will stand up against discrimination. Thank you.
Thank you so much for taking the time to join us, Representative. We sure appreciate that.
Thank you.
The next steps are to outline the strategies identified for how best to resolve the matter. And I'm going to lean on Mr. Spinks. I'm sorry, I'm looking around for you on my screen. Daryl, would you talk about the three opportunities that we've discussed or that your staff identified that may help us to address this in the best way possible? You're muted.
Sure, Madam Chair. Let me do a little bit of cleanup here real quick. Yes, the representative. Okay. Yes, we've got, we have come up with three options. These are not exclusive, obviously. If anybody has any other ideas, we're certainly open to that. But we've developed three options to address the situation with the social work rule. I'll just launch directly into these. The first option being we can stick with the original decision to adopt the rule 781.301 with the governor's recommended changes, but then in an internal motion or vote, basically redefine the term sex to include gender identity and gender expression, or I forget the exact language there, but the two terms. You can do that so that basically both the council and the staff would have directive as to what the term sex is to include those two terms. That option does not address the repeal of the term disability from the rule, but of course disability is obviously covered by the ADA, and a violation of the ADA would also mean a violation of the council rule that requires all licensees to comply with all state and federal laws that impact the practice. So there's still a nexus or a hook, if you will, for individuals that discriminate against someone with a disability, person with a disability. But that term wouldn't apply or wouldn't appear in the rule. That's option one. Option two is option 2 is going to be the most complicated out of all the options that I'm going to present here. And basically it goes like this. We maintain the old rule 781.201. We keep it on the books. In other words, we don't repeal it. It was proposed for repeal in the July 17th edition of the Texas Register in that rules package that went over. We could keep it on the books. We could also adopt the rule with the governor's changes 781.301 with the governor's changes. So in effect, you would have 2 rules. You would have the old rule that has the 3 terms that were removed based on the recommendations from the governor's office. And then you would have the new rule, which does not have those same terms. So you're going to have 2 rules in effect. Now that does one, I mean, obviously, I think probably the effect of that is pretty obvious in that you still keep the protections, but you also have the new rule as modified requested by the governor. We would then need to seek an attorney general opinion to see whether or not we have the statutory authority to include those 3 specific terms that are under the old rule. So that's option 2. Option 3 is probably the simplest. I'll say it's not option 1 is the simplest, but option 3 is probably the middle of the road as far as complexity goes. And that is we simply adopt 781.301 as it was proposed in the Texas Register. And as it was proposed in the Texas Register, it has the terms disability, gender identity, and expression. It has all those terms in it. So in effect, nothing would change. The protections that were there in 781.201 would still be there in 781.301. We would then seek an attorney general opinion again to see whether or not we have statutory authority to include those terms. And then depending upon what that opinion is, we may need to come back and revisit the issue. So those are the 3 options that I've been able to come up with on how to address this situation. What makes all of this possible, or what makes options 2 and 3 possible, really are the fact that I have not sent those rules over to the Texas Register yet. They have not been published. They are not the law yet. Really, the current law is still 781.201. If you look in the TAC right now, 781.201 is still the law of the land. So I put those after our October 12th meeting. I put those in my back pocket. I've still got them sitting here on my desk. They have not been sent over. That's what allows us to kind of come back and revisit that decision rather than having to propose new rule changes and go through the rulemaking process to make any changes today. We can simply vote to revisit our decision on October 12th. So those are our 3 options. Now, I will tell y'all there are legal implications for all 3 of those that I need to visit with y'all about in closed session. Kind of some of the pros and the cons based on the law. And we need to, you need to hear those before you make a decision, I think, on what you want to do.
So before we move on with that question, how long does it normally take for an attorney general's opinion to run the course, run into the attorney general and then back to the council, on average?
Probably, I'd say 90 to 100 days, 90 to 120 days is probably what I would say on average. I've seen it be very, very short within, say 30 days. And I've seen some, there's one particular request for AG opinion out there from Johnson County that happened back in the 83rd legislature, and it's still sitting out there as far as I know. It has not been answered yet. So that's the outlier, obviously, but.
Sure. And so my second question is, were we to keep or rescind during that vote, would it be possible for us to incorporate language that assumes that the term sex discrimination includes gender identity, gender expression, and sexual orientation in the meantime? Can we interpret it to be that as a board representing social workers and other behavioral health professionals while we wait?
That's probably something we want to talk about in closed session. I want to visit with you about the legal implications of doing that. Yes, ma'am.
Do any other board members have, council members, have remarks or questions for Mr. Spinks? Okay.
I do want to make clear to the public that's listening that with options 2 and option 3, I want to make crystal clear that if the council goes with either one of those, the protections that everybody is concerned about would be on the books. There wouldn't be, the rule would not be devoid of prohibitions on discrimination against disability, gender identity, and gender expression. Those would all still be protected under the rules. So either way we go on option 2 or 3, the rules are going to prohibit discrimination against those particular individuals. I just want to make that clear.
Thank you so much, Daryl. Does any council member wish to ask a question before we proceed to closed session in order to consider the legal implications of these 3 strategies? Going once? Fine then. The Executive Council will go into executive session at this time pursuant to the Texas Open Meetings Act on agenda item 4 in order to receive legal advice from its attorney. Oh, say that's open session. Did I say that right? Daryl?
I think we need to go into closed session.
Let's go into closed session. Okay, sorry. I have guidance on the language so that I won't mess up. In that case, the closed session is called to order. The date is October.
Hold on just a second, Madam Chair. No, first off, let me tell the council members, I just sent you a link to the closed session. It will be a separate Zoom meeting than what we're in here. What you will need to do is once we recess from the open session to go into the closed, you'll need to leave this meeting. Click on the leave button, and then you'll need to follow the link that I just sent you for the executive session. The public, you can stay in here. I will leave this webinar. It will continue to run, but there won't be anybody. You will just see my symbol, the BHEC symbol will just appear up there. And then once we're done with the closed session, we will all log back in to this session, and we'll resume the open part of the meeting. So what we need, read the first part of your script there again, Madam Chair.
It says the Executive Council will go into executive session at this time pursuant to the Texas Open Meetings Act on agenda item number 4 in order to receive legal advice from its attorney under section 551.071 of the Government Code. Is that correct?
Yes, that's it. Stop right there.
Thank you.
State the date and time
The date
as
is
well.
October 27th, 2020, and the time is 9:43 a.m.
Okay. All right.
So
So
now we press leave. Okay,
council
got it.
members, you all leave the meeting, go into the link for the executive session.
Good morning, everyone. It's 10:47 a.m. on October 27th, 2020, and the Texas Behavioral Health Executive Council is now reconvened. Are there any motions on agenda item 4?
Hold on just one second, Madam Chair, while we're all connecting up.
Sure. I think that's everyone.
No, we're still lacking Mr. Morris
Mr. Morris.
and one other. Dr. Fletcher is not
Dr.
here.
Fletcher. Mhm.
Madam Chair, this is Chief 4 rejoining.
Thanks. We're just waiting a few more moments for Dr. Fletcher and Mr. Morris to join. Mr. Spinks, maybe we could text them. Do you think they might be having trouble connecting?
Yeah, I just sent them an invite again, just out of
Okay.
abundance of caution.
Sure, I'll just wait a few more minutes because I know everyone's been waiting for us. For those of you who are joining, thanks so much for your patience. Do we have a quorum right now, Daryl, of our board members, of our council members? I always say board, sorry. There's Dr. Fletcher.
Yes, you do.
And at this time, I'd like to entertain a motion regarding item 4 on the agenda, the discussion whether or not to initiate rulemaking to adopt the non-discrimination requirements for licensees.
Chair
Do I hear a
Canseco,
motion?
Chair Canseco, Tim Brown, Social Work Board. I would request that we adopt option 3, where we send forward the rules that were originally presented in July, which include sexual orientation, gender expression and identity, as well as disability.
Thank you. Do
And-
I hear a second?
And Chair Brown, that's without the governor's recommended changes, correct?
Correct.
Is there a second?
I'll second.
Thank you, Mr. Bielmowitz. There's a motion and a second to adopt option 3 that would send forward the rules as originally proposed by the Social Work Board that contain the language referring to prohibiting discrimination for gender, gender identity, sexual orientation, and disability. Is there any discussion? Going once? If there's no discussion, may I call for a vote, please? All in favor, please signify by saying aye and raise your hands for purposes of the video call. All in favor?
Aye.
Aye. Any opposed, same sign? Then let the record reflect that the motion passes unanimously with board members present. Mr. Morris is not online just yet. Thanks, everyone. Let's proceed to item number 5, the status report on implementing examination approval.
Madam Chair,
Yes.
do we want to discuss requesting an Attorney General opinion?
If there's a motion, we can certainly do so. I would now
like to-
entertain a motion to, go ahead. If you have the wording,
I'd
go
like
ahead.
to, well, I don't have the wording.
Sure, I'll help.
But I would like to, I would like to seek the AG's opinion. And before I make a motion, I'd just like to put a couple of things on the record here, because we've been kind of told that we may not have the statutory authority to enact some of these change, or to keep some of the rules on the books as they were. I'm just a simple guy and I'm not an attorney, but when I do read the code, I do want to put a couple of things out there that both the Social Work Board and this board has the authority to establish standards of conduct and ethics for license holders. In another section, 505.2015, it actually says the board shall propose to the executive council rules regarding, in section B, the scope of practice and standards of care and ethical practice of social work. And again, if this is an ethical issue, I think that we probably have the statutory authority to do so. And 505.0025 defines practice definition, including ethics as part of that as well. So I would move that we seek the Attorney General's opinion to tell us why we don't have the authority to keep these rules on the books as they were, or to also potentially enact other, why we would not have the authority to enact other rules across other agencies or the other licensing boards to the same end.
With regard to scope, ethics and standards of care, correct?
Correct.
Just so
Is
I'm
there-
clear, Mr. Belimowicz, you want, your motion is for an AG opinion, not only as to the social work board, but you also want to request an opinion as to whether or not the other boards would also have statutory authority to enact similar provisions in their rules.
Why they would not have the authority to do
Correct.
so.
Correct. Okay.
If that doesn't open another can of worms that we don't want to, but yeah, that's
No.
okay.
I just want to make sure I
Yes.
understood what you were saying.
Yes, sir.
Do I hear a second?
Second.
Is there any discussion? All in favor of Mr. Belimowicz? I hope I said that right, John.
It's good enough.
Okay. To seek an attorney general's opinion regarding the standards of conduct, the ethics, and the scope of our authority, and why we might not be able to clarify the language regarding prohibition of discrimination for these particular reasons and others that might come up, and whether or not that might also apply to all behavioral health professionals that come under the scope of the council's authority. All in favor, please signify by saying aye.
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 Aye. Any opposed, same sign. Again, Mr. Morris has not been able to chime in just yet, but the motion passes with the unanimous consent of members present. Thank you so much, John. I think that was an important move. Is there anything else before we proceed to item 5? Then let's hear a status report on implementing the examination approval for the Texas State Board of Social Worker Examiners applicants through the American Social Work Board licensing portal. And I believe that's Daryl.
Madam Chair, I'll go ahead and give this report. I would respectfully request that we maybe take the next item of business after this be the LPC rules. I know that some of our council members aren't going to be able to be with us all day. And so I want to make sure that rules package gets taken up while the LPC board members are here with
And
us.
could you remind me what item that is on the agenda? What
Sure.
number?
It's going to be 12A.
Got it. Thank you.
12, actually, all of 12.
Okay.
Okay, the status report on the ASWB contract. The contract signed. ASWB is working on, they've developed the applications for the LBSW, LMSW, LCSW. They've sent those to me for review. I simply haven't had a chance to review them yet. We're building the website end on our side so that when people come to our website to apply, it will they'll automatically be redirected over to ASWB's website where they will apply for, sit, take, and pass the exam. Once they've passed the exam, they would then be directed back to us. The idea behind this process being it's going to cut out about 2,500 applications a year that staff are having to review. In other words, it's going to reduce the workload significantly on staff so that we can focus on the processing of the actual substantive parts of the application. Hopefully speed things up. As you all know, it's one of the solutions we developed to address the backlog. So we were originally shooting for a November 1st date. I don't know that I'll hit November 1st, but it shouldn't be too long after that that we launch it. So we'll try for November 1st, but it may be a couple of days after that before we actually are able to implement it. But it's progressing along nicely.
Thank you. And for those of you who are new to the council, this was a backlog and applications that we inherited from the Department of Health and Human Services that took place transferred to us on September 1st. And because of the backlog, we've gone digital. Who would think in 2020? Is there any discussion or any questions from Mr. Spinks? Thank you and congratulations. That's an important move for us. Let's move to item 12. Do I need a motion to approve moving that item on the agenda? Or should we just proceed that way?
Yeah, no motions needed because it was just a status report.
Okay.
Madam Chair, I think Mr. Morris is with us. Ben, can you hear us now?
Yes. He's on mute. You want to unmute? There you go. Hi, Mr. Morris. We lost you for a minute.
Okay, well, I had y'all in my sights, but y'all couldn't see me. And just for the record, And I had texted to Alice Bradford, my vote was aye on the original vote that we came back to.
Thank
Okay.
you so much.
You're welcome.
And we'll let the minutes reflect that, if you will, please, Daryl.
Yes, ma'am. Okay, 12, moving down to agenda item 12 for the LPC board. These are, what we have before us here are the rules that were proposed for adoption. This is the overhaul of the LPC rules that was necessary following the creation of the council and the transfer of regulatory authority to the council. This is the complete rules package. Now, you'll see there were, unlike the social work rules, excuse me, there were public comments that were rendered on the LPC board. I've sent those comments to you so that you can see them. The LPC board has made the only change that the LPC board had recommended to the council was the re-inclusion of a definition that had been, there was a definition that we had proposed to strike. The LPC board wanted to leave it in. It's highlighted in yellow in the rules that you have there. The only other changes that are in the document are the changes that were recommended by the governor's office. I've got the index for you there. Let me pull up the rules so that we can go by those changes, because there's something unique about this I want to discuss with you, and y'all kind of decide which way you want to go.
Thank you.
Okay, so I'm going to share my screen here. Okay, so you are now looking at the rules as they were recommended to us from the LPC board. Now, the governor's office has recommended some changes on a few of these. The first being on page 7. This is a change. Now, what I want to mention to you is that the LPC board has not had a chance to review the governor's recommended changes. So on matters like this, what I would recommend is I would recommend we adopt the rules without the gubernatorial changes, without the OOG's recommended changes, and then we'll simply take these rules back to the LPC board at their next meeting. Here's the problem. We have got to get some rules on the books. The social work board and the LPC board are the only ones without their finalized rules on our books right now. We just solved the problem with the social work board this morning, but now we need to get the LPC board rules finalized. There are some big changes in these rules, like the change from LPC intern to LPC associate, that people are chomping at the bit to get that finalized. And if we just say, well, we're not going to adopt these rules, we're just going to kick them back, it's going to be 3 or 4 more months before this stuff comes back to us. So, and these are changes that I feel comfortable enough where we can just go ahead and adopt. Some of them are just little syntax, typographical type changes, which we can go ahead and adopt, but changes like what you're looking at here on the screen, I would say let's just adopt the rule without this change. I will then take it back to the LPC board at the next meeting, and we'll visit with them about it and see what they want to do. We got to get something on the books here. We got to keep moving forward because we're stalling out here playing ping pong back and forth. So
You mentioned something in yellow. What page was that?
that's on.
You wanted us to attend to or ignore? I didn't quite catch it. I see.
Well, it's the LPC board is recommending that this definition be left in. And I don't see any problem with it being left in. So I think it's fine to leave it in.
Any discussion?
It was a change that they had received a lot of public comments on, is why they put it back in there. So.
Okay. Anything else you want to bring to our attention before we entertain?
Let's see, page 7, there's that. I would recommend on page 8, this is a typographical change. I'd say go ahead and adopt that change. I'm just kind of showing you the changes so that you guys can see and the public can see what. This is actually, this change doesn't need to be made, the one that's up on the screen. I think there was a misreading of the rule and the family code. I think people read it to say an LPC can't be a parenting facilitator. What the rule actually says is an LPC associate or what used to be an LPC intern. So it was just a misreading. So no change needs to be made right there. See page 28. Again, this is one where I would not recommend adopting this right now. Let us go back to the LPC board with it and visit with them. The change on page 29, we can go ahead and make because it's just a typo. It's an extra section sign. No change on page. No change is
Mr.
needed.
Spinks,
Yes.
I just want to be very careful here and make sure that I understand that when you say not to accept the changes, once again, the question comes to my mind, do we have the authority as a board to not accept what has been presented by the board? Because, and the reason why I'm asking this, I just know that if it were to come from the Marriage Family Therapy Board and BHEC decided that they weren't going to make the changes and send it back down, then I'm going to question that. And so I just want to make sure that we either have a representative from that board speak to that and that they're okay, because I just want to make sure we're not setting precedents in terms of overreaching our authority and overstepping the bounds of the boards that are submitting things to us. I want to be very cautious of that.
These are not changes that were recommended by the board, though, Mr. Francis. These are changes that have been recommended by the governor's office.
Okay, so
Mr. Francis,
the changes.
Dr. Taylor and LPC board, I'm happy just to clear this up for you guys and say I'm supporting.
Thank you.
I'm in full support of everything that Daryl's saying right now.
Okay, I just want to make sure that the board, we have the support. Thank you.
I appreciate you looking out for us, so I would do the same for you. So thank you.
Thank you.
As the other LPC member, I agree wholeheartedly.
Thank you.
Okay, the next issue is one, again, it's one that I think we need to let the LPC board weigh in on, because it's a question of how do you view the language in this rule, and I don't know the answer to it. So that's one that we really needs to go back to them, and we need to get their input on that. It's 34. Same thing on page 35. The change regarding military applicants, that's one again that will have to be revisited. Actually, all the boards are going to have to revisit their particular military licensing rules. So it's not anything unique to the LPC board. That's one we'll take back, and we just need more time to visit about that.
Pardon me. To mute.
30, the change on page 38 is okay, because the LPC board is actually proposing to withdraw this particular rule and propose a new one in its place. So that change is okay to go forward. And then the change on 44, that actually matches up with the change we made up on, or the recommended change on page 7. So it would need to go back to the LPC board as well. And then the change on page 50, this was a misunderstanding between, I think people just didn't read the term associate after licensed professional counselor. So it's a correct statement of the law is what I'm trying to say. That particular change is right there. It needs to stay as it's written. So really
Daryl, I think that's actually reflected in the comments too. It says that provider that an LPC can serve as a parenting facilitator.
Yes.
So very clear that they just missed that.
Yeah.
And we changed it too. It used to say intern, now it says associate. So I think that's
correct. Correct. So there's what, 3 typographical changes that we can adopt. The rest of the changes that have been pointed out by the governor really need to go back to the LPC board so that we can visit with them about it. But we can go ahead and make the 3 typographical changes on page 8, page 29, and page 38. Those can be adopted now. So with that, I'll open it up to discussion, but we've got the rules package. The LPC board has recommended adoption of the rules. They've only recommended that one change, the highlighted text I showed y'all earlier. And what I'm suggesting here is that we go ahead and adopt 3 typographical changes that I just outlined. The rest of it, we can take those changes back to the LPC board, let them mull it over, and then when it comes back up, we'll deal with it.
Thank you. Sorry, I unmuted because I coughed. Is there any discussion regarding this item? And if not, may I hear a motion?
Madam Chair, I'd be happy to make a motion that we adopt these rules with the typographical corrections on page 8, 29, and 38.
I will
And
second
I'll
that.
second it. Oh, go ahead.
I will second that motion.
Thank you. And to be clear, this will mean that any changes recommended by the office of the governor are remanded to the, which board is it? The professional, sorry.
LPC.
Yes, LPC, back to the LPC board for their consideration and recommendation at a future meeting. Is my understanding correct?
Yes, Madam Chair, and we'll be happy to do that next week.
Oh, good. Thank you. Is there any other discussion? Any questions?
The one other issue I'd like to point out is, Dr. Taylor, does your motion also, did you intend to include the withdrawal of 681.164 in with your motion, excuse me, in with your motion as well, because the LPC board had recommended withdrawing that rule out of the rules package because they're going to repropose a new version?
Yes, that's correct.
Okay.
Then all in favor signify by saying aye and raising your hand.
Aye.
Aye.
Mr. Morris, are you in or out?
I'm in. Aye.
Okay, good. I couldn't see you.
Okay.
Thank you so much, and the motion passes unanimously. On to item 6, discussion regarding possible solutions to address the licensing backlogs.
One more, Madam Chair, we've got a couple more rules that we need to get y'all to vote on.
Oh, I'm sorry. I thought we were finished with item 12.
No, we got 12B, which is,
okay, 12B.
yeah, as part of that rules package we just adopted, we withdrew 681.164, and the LPC board has proposed a new rule in its place.
Okay.
And so that's what we need to have a vote on now. And it's
Okay.
the rule that's up on the screen now.
And how does it differ from the prior laws? It's strictly,
This is one, we're trying to standardize this rule across all the boards and try to make sure it meets the issues that have been brought up by the governor's office on whether or not an offense is directly related to the practice of fill in the blank. So that's what it's designed to align all the rules across all the member boards.
got it. Thank you. Any discussion? If not, I'll entertain a motion to pass as proposed.
I'll make the motion to pass as proposed.
Thank you, Susan. Is there a
I'll
second?
second.
Thank you, Dr. Bateman. All in favor? Is there any discussion on the motion? All in favor, please signify by saying aye and raising your hand.
Aye.
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 Any opposed? Same sign. The motion passes unanimously. Looks like we're on to 12C, Daryl.
Yes, ma'am. And that's the last rule. This was kind of an orphan rule. It was a rule that the LPC board had originally proposed up to us with some modifications to some language that we just statutorily couldn't do. So when it went back, the problem was it got pulled out of the main rules package that we just adopted, and it's a timing issue is what it is. So the LPC board is recommending the proposed repeal of the current rule and replacing it with this language here. And substantively, it's no different than what's already on the books, except we've changed like the word, I think, board to council throughout the rule.
Is there any discussion? If not, may I hear a motion to approve the change as proposed?
I so move to adopt the changes, Madam Chair.
Thanks, Dr. Taylor.
I'll
Is there a
second.
second? Thank you, Tim. There's been a motion and a second to approve as proposed. Is there any discussion on the motion? If not, I'll entertain a vote. Those in favor signify by saying aye and raising your hands.
Aye.
Aye.
Aye. All opposed, any opposed, same sign. The motion passes unanimously. And I think we're finished with 12 and we move back up to number 6. Discussion regarding the solutions to address the licensing backlogs. Daryl, is that you?
Quick, thank you, Madam Chair, for agreeing to that agenda change. Those were very important rules, and it's LPC is grateful that we got those passed. Thank you.
Sure, delighted. Daryl, item 5. Sorry, 6.
Yeah, item 6 is something that I think you and Mr. Francis had requested be placed on the agenda at our October 12th meeting. So I probably ought to defer to one of you two to lead us off in that.
Do you want to take this?
That's not a problem, Madam Chair.
Yes.
If you would like to start, or I don't mind starting, whichever your preference is, please.
Sure, please go ahead, George.
Thank you. So this is coming about in regards to the situation in regards to the backlog. And I'm sorry, I'm pulling up my notes as we speak here to make sure that I don't misstate or misquote here. So I had a couple questions, please, Daryl, in regards to this. Right now, do we know what the size of the backlog is or how many applications are in the backlog itself?
We do. Yeah.
And what is that size, please?
Pull it up here.
Are you going to share a screen?
Yep. Let me put that up here. It's 528. It looks like 528 applications haven't been touched.
And that's
Okay.
that's huge progress compared to.
It was 800 and something.
Not bad.
And on average, Daryl, how many applications can we process a day, please?
I don't know that, Mr. Francis, off the top of my head.
Do you know historically how many we've been able to process on average, or I'm trying to figure out what time frame this roughly represents in terms of how long it would take to process.
Here are the numbers. I'm not sure you're seeing that. Hang on a minute here.
We're seeing the summary page.
What's the number you see down on the total? Is it 815?
Yes, it is.
Okay, then you are seeing it. Never mind.
So on September the 1st, it was 638.
No, as of October 7th, our backlog was 815. And then as of October 26th, it was 528.
So 300, it's about 100 a week. Is that right? 3 weeks?
Mm-hmm. Yeah.
Is it realistic to expect then that we will be through this backlog in about 5 weeks then? Is that what your thoughts are? Or let me not put words in your mouth. What's the expectation that we would be through the backlog?
Assuming everything goes correctly, I'd say in 5 weeks. If everything keeps rocking along smoothly, that's the problem.
Not including Thanksgiving.
Yeah,
Wait.
well, the holidays.
Right.
You know, one of the things you need to keep in mind also that has assisted in bringing the backlog down is I've authorized OT. So I've got people working overtime. If the money runs out on that, that's going to impact our ability to keep up, if you will, because that certainly played a factor in bringing the number down that quickly. And what I'm doing is I'm cannibalizing off the vacant positions that I have right now. What salaries I would have been paying to that individual is what I'm using to pay the overtime. As I fill those positions, that money goes away or gets reallocated to the actual person that's filled the position. So, Ms. Francis, I don't know to what effect, I don't know to what effect that's going. I don't know how much that will slow our progress on chewing down the backlog, reducing the OT. But then again, I've got somebody, I will have hired somebody, so they will be working on the backlog. as well. So it may very well be a 1-for-1 offset.
And if you'll bear with me, I also have some ideas that I wanted to bring up to you as our previous discussion. And so if we brought somebody new in today, how would we train that individual? What type of training would they receive to be able to start processing applications? What do they go through?
They sit down with an experienced process applicant, licensing and specialist permit, who teaches them. First, you got to teach them how to use the system, the Versa, the database system. Then you have to teach them how to actually process whatever particular application that they're assigned to. And that's what you're doing, is you're teaching them what to look for there. What are the most common issues that you're going to encounter? How do you write the deficiency letters? Just kind of the step-by-step process that they need to go through to both on the intake of a license and then how to handle correspondence that needs to go out. It's a one-on-one type training.
So anybody that is newly onboarded pulls away from an individual that's currently doing the processing. Am I hearing you correctly when you say that, please?
Correct.
Okay. So I have a couple thoughts for you here, please. And these are just things when I was sitting there trying to think about how would I address it or what can we possibly do? Because there's two things here. One, I want to make sure we understand how do we get in the situation, and I'll talk about that in a minute so that we never get in the situation before. Because as you just so aptly stated that if we run out of money for overtime, then the ability to expedite processing goes away. And so we go back into a methodology that slows things down that could potentially build up our backlog again. So how do we address that? And then how do we obviously address the other part of the problem, which are the applications that are currently in place? So the first thing that I have on the list here is, have we looked at setting up a memorandum of understanding to help with another agency so that we can utilize individuals from other agencies to help with the backlog?
No, no, we have not. And the reason being is because the other agency would need access to the database to do it.
Would we be able to bring that individual, if we did an MOU with that other agency, wouldn't they be able to come into our workspace, or wouldn't we be able to provide them with access to that database?
You could, yes, I mean, you could do that. You get into the fact that actually the Health Professions Council is actually the one that manages our database. It's a shared database. It's shared amongst us, the Plumbing Board. There's several other agencies that actually use this database. So you get into some pretty serious issues of security on that once you start giving outside entities access to that. And I don't know what all it would take to satisfy them.
Is Versa cloud-based?
Yes, it is.
So
I would like us, I'm sorry, Chair, please.
I'm thinking about the different levels of access that can be awarded normally in it, then that can be permitted normally with a database. And one of those might be, I mean, I understand your concern about HIPAA and about security, but I think that that's normally addressed by these databases and their user level privileges. Am I right, George?
That's what I would have answered, but so I'm not quite sure why that's a concern.
Me too.
But well, let me tell you where I'm going with it, because I think that's an option that we need to explore. And even before that, as an executive director, you have the ability to spend up to $5,000 to bring other people in. My recommendation is that we bring in someone on contract to look at process mapping, how this works. And the reason why I suggest that is because, as you just stated, if we bring somebody in right now, we have to have them sit down with a current individual that trains them step by step. If we bring in a contractor to do the process mapping for us, what that allows us to do is to understand all the things and how they have to happen, document it, and then be able to provide a new employee in a different fashion that does not pull away from existing employees. Now, does it take away from some of the things that we do now for them to be able to get their answers? Of course it does. But it's a long-term play versus a short-term play that helps us not get into the situation again. We have the money to be able to do that. We have the authorization to be able to do that. And in all honesty, it's just a recommendation of good business to do process mapping of what we do. Not to mention, it helps us further identify where we have any obstacles or hindrances in our process or friction that we can smooth out so that we can make it a better process and we can actually speed it up a little bit. So that's thought number 2 on that one. Thought number 3 is that we have schools that we know are incredibly good. When we see documentation from those schools and those particular professors, the question is, do we have to go through the same rigor that we do with schools or professors that we don't know? And we know, like, for example, coming out of San Marcos, exceptional, right? So is it possible to put in place that if we see applications with certain schools or certain professors, that we can expedite those through the process so as not to take the same amount of time for those applications where we don't know anything about that applicant, the process, the school itself? Is that something that we might be able to consider?
You can, but I think you're assuming that the hang up is always on the school, the degree or the training program itself. And I don't think we can do that. I think that would be something we'd have to study to see where is the majority of the hang-ups coming from on applicants. Is it in the training program, or is it in the supervised experience that occurs outside the training program? We need to take a look at that.
Yeah.
George,
I agree, and that's why I'm sorry, please. Go ahead, Chair. I'm sorry.
I have a little bit concern about number 3 in that I have worked at the UT Health Science Center. Granted, it's in fundraising, but currently in my current job, we are the public health rotation venue for the School of Dentistry. And I know that there have been, although that institution is one with a high reputation of turning out the best dental professionals in the world, in the state anyway, we have had some issues that their administration could not tackle. And some of them involve mental health, and some of them involve personality or burnout. Although those folks can graduate academically, the schools themselves struggle when their students are suffering. And so I think that to base it on the reputation of an academic institution would generally be reliable, but not always. And I think that might be taking a step that we don't want to take. And this is not to say that a school is not doing the best they can, but things escape folks' attention or they're hamstrung by laws. But I love the idea of process mapping and of getting an outside consultant to do that. I think, again, that would move us more firmly into the 21st century.
In regard to 2 things there, please. So I should have been more clear, so please forgive me for that. I was thinking of those areas specifically like curriculum. I know from the perspective of the Marriage and Family Therapist Board, we look at the credits that come for an individual and the classes that they took. But if we know the program that somebody comes from, we already know how the classes are typically set up. Now, there, of course, are going to be those anomalies, but overall, they should be pretty darn close to base. So not the other aspects that, as you so aptly stated, that could relate to an individual themselves. I was talking about those areas that were more general. And then, Daryl, to your point, I agree. I'm not assuming that that is where the hang-up is. It's just a possible area for us to look at. I think we have to go to the process mapping to understand truly where are the delays and where are the long poles in the tent. What are the things that need to be changed that would allow us to process faster? And so when I identify any one area, it's not because I think that's where the problem is. It's just a possible area for us to look at. They're just recommendations, and that's all that it is. So the next area that I have is one of the things that I know that we have to do a lot of before we can move forward is scanning. And I know that there's a company that's currently being used by many of the agencies called Nubis. And so the question becomes, is it possible to bring in an outside company like Nubis that would be allowed, or not be allowed, because I know they're able to by state contract, but is it possible to have them come in and do all the scanning work for us, which then allows our people to do the processing versus taking that administrative time to actually scan the documents in? And so pass off some of that workload. That would be item and suggestion possibility number 4. Have you considered using a company for the imaging?
I have. It's just the cost of it is why we haven't really explored that. What I am doing is I'm trying to use, my goal is to use the volunteers that we're trying to solicit right now between the social workers and the LPCs to help us with that area, to get some volunteer labor in here. The problem I have is I've only got so many scanners, high-speed scanners, that I can have people at a time. I think I've got 3 high-speed scanners in the licensing division, and maybe 3, maybe it's just 2, 3 over here in Tower 3 where I am. So, I mean, you know what, you can have 5 people at a time, you know, scanning there, but it's still better than having staff do it because of what you said. You know, it's if we can get volunteers to scan it in, then my folks only have to deal with the processing of it.
And so this one just happens to be something I'm fairly close to and near to my heart. After owning a document imaging company for 10 years before I sold it to Xerox, companies will bring in their own scanners that are much higher speed. I mean, the old equivalent would have been a Kodak 9600 that would have done 150 pages a minute. But you allow the company to come in and do that scanning for you at a much higher rate. They're in, they're out, and they allow your people to do what they do best, which is at the core processing. The goal is to have all of our resources do what they're specialized at, right? And remove those things that can be put off to somebody else that don't necessarily need to be done with our team. That's the reason why I was bringing up Nubis, or for that matter, there's at least 15 different scanning companies on the state's list. So any of them could do that job, I'm sure, equally as well. So I'm not advocating for one company. Please don't take it as that. I don't know anyone there, have no stock in them, nothing like that. It's just an example to use. The next one is one of the comments that we were talking about before. Can you explain to me what our current phone policy is and how we're having people answer calls? What are we currently doing, please, just to make sure that I don't misstate or misquote anything?
Sure. As calls come in, they're directed to the LNP's voicemail. That LNP then returns phone calls and emails on 1 day a week. There's 1 day where they are in the office. That is their dedicated response day, that they return phone calls and emails. The remainder of the time, they are actually processing the applications. And the reason we did that is because if you have them answering the phone and responding to emails all the time, they can't get anything done as far as processing. It just slows you down to such a crawl that, I mean, we weren't having any luck.
So you're we're still under-resourced, and we've asked for increased staff through the LAR,
Correct.
Is that correct?
Correct.
So I happen to be talking to someone from our logistics team, and I was posing this problem to them. And I thank you for stating that. I just want to make sure that I have posed the correct question to them. And the recommendation that came back was that you will have individuals on the team that are very good at what they do in terms of processing applications. And then you will have individuals that are not as good. And that's not to say that they're bad or that they're inadequate or anything like that. That's not the message here. But they're just not as efficient. And you're going to have individuals that can handle phone calls better. The thought is that you remove the individuals that have the least efficiency in terms of processing the applications, and you have them on the phones on a daily basis. And you don't try to mix them where half a day they're processing apps, half a day they're doing phones. But you have that one person assigned to the phones all the time. It's not going to get us to where we want to be in terms of our customer service, in that people are going to get immediate answers to their phone calls, because that person will have to obviously chase things down and figure things out. But what it does do is it gets us to answering the phones more than 1 day a week, which in my world that's not an acceptable solution, because it can't be that you can go to a business and they're only answering their phones 1 day a week. We have to reassign the resources. And the way that was recommended to me to do that was move your least efficient processor of applications onto the phone, or ideally the best person to handle the phones onto the phone, and leave everyone else to applications. And I would just like us to consider that possibility if we could, please. Let's see. We talked about bottleneck sticking points with the consultant, memorandum of understanding. Okay, and then the last thing, if we could, and this is not the appropriate time to do this, because the time right now is just to get through this and get the customers we serve back online and get them what they need. But what I would like to put out by a couple months and put on the agenda is we really need to do a root cause analysis of how we got here. And the reason why we need to do that is that if we don't look at it and truly understand how this problem came to be, then we're very likely to repeat the situation before. And maybe next time it doesn't happen in this space, maybe it happens in another board space, but we really need to identify what happened here so that we don't repeat the same mistakes and we can make adjustments to our process. So between having someone do the process steps and analysis, having someone do a root cause analysis, that ultimately will lead us to a methodology at the end that is the best case scenario in terms of the number of applicants that we can process through. So that pretty much sums up the recommendations and things that I would ask for us to look at, and then to report back on if it helps or how much it helps. Thank you, Madam Chair. I appreciate the time.
Thanks, George. It's nice to have a business perspective. Tim?
Yes, thank you. I've been fortunate enough to spend a week and then multiple weekends at the VHIC, trying to help. I hope I've been helpful. I want to make sure that everyone understands the staff are very competent and very focused on getting through all of the backlog. Everyone's been most gracious to me with my presence there, and I've tried not to come in and tell people what to do or how to do it. I've tried to stay out of the way and do only those activities that would focus them back on processing and interacting with the licensees or the potential licensees. And I certainly didn't do a Lean Six Sigma on the processes, but in my position, my day job, I review and look at changing processes for more efficiency all the time. The one thing that I'll share, my thoughts are, the staff are inundated with paper. And this, I'm not trying to tell anybody what to do. I've talked to Daryl about this. I've talked to Tim Spear about this. You know, and sometimes the big pie in the sky, I go that direction quickly. My thought is if there's ever some way to develop where social workers, potential social workers, can enter into a portal, something like ASWB is setting up for us, where they go in and upload all of their documents and allow the school to upload the transcript, so there's not paper flowing every which direction trying to keep up with, and that the individual cannot process or submit their request for whatever type of application they're wanting to do until all the documents are in place. And then it appears to the licensing specialist to approve or unapprove. Something of that nature would make it so much more efficient for the staff. Because I know they are working hard. They're working smart and they're working hard to do everything they can to get caught up with the backlog that was inherited. But you know, with ASWB taking out the section or the amount of work to approve examination, that's going to be helpful from what I've observed firsthand on site. But I think if there's ever any way, and I know Mr. Spear shared that another discipline board is working or is using some type of portal and that might be able to be adjusted for the social work board. I think if there's ever some way or some grant or some funds that we can get to either develop this or adjust a model that's already out there. And I think it's a quick fix. I don't think it's something will take a long period of time because there are coders that could put this together probably on a weekend. Something like this, I think, would be very, very helpful. And Mr. Francis, you may know of some people that could do this, or maybe there's a group of grad students that need a project to do to finish their graduate program. This is one of my thoughts that could help keep us from getting there again.
I agree. We've got to get out of the paper business. Paper is dirty, paper is slow, paper gets destroyed accidentally. And so we want to be out of the paper business. That's ultimately the issue.
Agreed. I love the idea of process mapping. I love the idea of the long-term play just for the sake of efficiency and cost effectiveness. And I agree that a coder could do this. I'm surprised one of you mentioned grants. Are government agencies entitled to apply for something like a capacity building grant, which is what this sounds like?
I don't know. I know we're precluded from taking donations. I know we cannot accept donations.
Right. Okay.
My only concern about adding more processes right now is it does look like we're chewing through applications, and I don't want to derail any chewing through of applications to investigate things until, as long as we're making good progress on this, which it sounds like we are.
And I know,
John,
I've volunteered quite a bit, and I know the vice chair of the social work board is going to be there for a week, I believe, starting November the 2nd. He's giving up time. And we also have a few individuals within the Austin area that are seasoned social workers, and they're willing to come in as well. You may not get as many volunteers for scanning because some individuals may not see that as glamorous.
Yeah.
I think I maybe have a PhD in scanning right now, which I don't mind because, you know, Daryl was afraid I'd be upset for scanning, but my mission is to do whatever I need to do to help the staff focus on the most important aspects, and that's of approving licensure, approving clinical supervisions, ending clinical supervisions, and allowing individuals from other jurisdictions to be able to transform their license into a Texas license. But you know, to John, your point, I'm doing all that I can and trying to rope in some extra volunteers, and I think we've got some.
Thank you.
Thank you for your time.
And John, to your point, I just want to make sure that I'm in agreement with you. We don't want to add more processes. We want to understand the process so that at a point in time, we can make modifications as necessary. And we have to be careful because, as Daryl put it, we're spending overtime dollars. That is a limited amount of funds. And if those funds were to run out next week, then we would still be in the situation where we currently are. So we have to get past the point of using overtime as the crutch to get through the issue. And that's why I'm also recommending a document imaging company to come in, because they're specialists at it. And they can pour through so much more paper than volunteers could. And their machinery is so much better than what we currently have that it's just like night and day. It just takes one big administrative portion out of the process. So I'm 100% in agreement, not trying to add steps or add roadblocks, trying to understand how we're doing it for future modifications to make it a better process.
And I think something like that could go hand in hand as we're tackling the current backlog with volunteers, with staff. As an executive director, Daryl has plenty of time, but time to look at this so that you have a long-term solution being developed as the short-term problem is being fixed. Wonderful ideas. Again, we don't want to micromanage you, Daryl, but some of this stuff is really worth looking at.
George, if you had to pick your top two, you gave us that list. I've got 6 things down here. If you had to pick the top 2 out of it that you would say, either explore this Sphinx and find out about, what would be your top 2?
Top 2 would be process mapping, because it gives you the most benefit long-term and gets you out of the current situation. And then number 2 would be having somebody come in to physically do the scanning, because as I understand it, everything has to be scanned coming in.
Yeah.
And so that's a roadblock. You only have 3 scanners. And so if you can have somebody come in with faster and more scanners to just knock out that backlog, then it allows you to start from a new point on the playing field. Those would be my top 2.
Me too. Those are my top 2.
On the contractor for process mapping, I'm assuming that a component of that would be somebody looking at the rules to see, is part of the problem here coming from rules, or is it from the actual process itself? I mean,
It's probably.
I apologize. I'm not sure I understand.
Well, I hadn't finished my question. That's what I'm trying to figure out how to ask
I'm sorry.
It's probably digitizing the application process to the way the ASWB board has done, so that as much as you can that's submitted digitally, you can do that. That's a database. Am I right?
Yeah, I think so on the
Yeah, someone would
digitization.
have to understand the rules, sure.
I guess my point is, I'm wondering if part of that contract, the process mapping, would that need to be something, is that something we would need to, as a body, comb through the rules first and have you guys decide, look, this is a problem in this rule because we're getting a lot of deficiency letters sent out over this issue? Is that something we would need to resolve first there before we had the contractor? No?
No.
Okay.
No, the contractor would come in, and you don't even have to come to us for the contractor. You have the authorization for the spend on that. $5,000 is more than enough to cover it, to give you the process maps that you need. Once they deliver the process maps to you, they'll identify where the friction is in the system, where things are not flowing as smoothly as they should. And then they'll make recommendations to you about ways to possibly change that. You'll have ideas once you see it, that flow on a piece of paper. Once you see that diagram and you see those red circles around possible areas, you'll know from your experience about where things could then change. It's just a matter of seeing it, but it's not necessarily rules. It could be something that's rule-based that says we have to examine every class from every, every class that somebody has ever taken. Okay, that's a rule. But I think you're going to see it could be several different things, and that's why we need to do it to identify what they are.
Okay, gotcha.
Daryl, if I can real quick, we noticed about a year ago with LPC, when we started to go to work on our backlog originally, we had licensees that were waiting 16, 18 months, a long time to get through the process. And we went to work simplifying the application, just taking out just complexities, making it a little bit smoother, getting the application down to 1 page or 2 pages, asking simple questions like, did you complete 3,000 hours, instead of asking them to break down all the hours and supervisors they worked with. We saw a great deal of success with that. And I think maybe that's what George is getting at. If we can get a company like that to come in and help us find those areas, that was just a tremendous success for us, bringing down our backlog originally. And then on top of that, I also just wanted to say, I am more than happy to come down to Austin as well and volunteer my time. I don't know if that'll help or not. Tim, thank you for doing that for social work. I really appreciate that. And let me know what I can do, Daryl.
Oh, you shouldn't have said that.
Well, I said it 2 years ago, and the attorney said I couldn't. So
I'll be in touch.
I'm ready to go. Let's go. I can answer phones like the best of them, man. I used to work at Blockbuster when I was in high school, so I know customer service.
And you mentioned phones, Madam Chair. I saw on the agenda somewhere where we talked about cell phones, and I know that we mentioned that previously. Would this be an appropriate time to have that conversation about the cell phones also as part of this conversation?
Yes. But I can't remember what the point
So-
was.
It's under 7. It's
Well,
agenda
I thought it
topic
was on-
7. So
Agenda topic 7. Okay, so phone calls and emails. What, did I see something on the agenda in regards to reimbursement of personal phones?
it's in the
Or
meeting
am I just-
materials. Yes, sir. It's in the meeting materials that I sent you from the comptroller.
Okay. Okay. So I think we've covered most of 7. We talked about having someone daily do phone calls versus just once a day. What are we currently doing about emails, please? What is our policy for returning emails that people send into the office?
It's the same as what I had just said earlier. On that day, that particular day, they are returning phone calls and emails. The way our voicemail system works, we take calls 5 days a week, so calls are always coming in. So let's say I'm a social work L&P person, and someone calls in to visit about an application I've got. It's not their call gets directed to my voicemail. That voicemail then converts it, changes into an audio file and is emailed to me, so that basically I have kind of a chronological list of people that have emailed and telephoned me that I'm now working off that list, just going down the list, returning emails and phone calls. That's how we handle that.
Okay. And so I would suggest the same thing as we did with phone, where we're not just returning emails once a week. I mean, the point is how do we increase and improve our customer service? I mean, that's what we're all here for. It's a common goal that we're all aligned to. And so what we have to get back to is being able to do that email every day. We have to be able to get to the calls. And I recognize that we're not going to be able to answer every email every day, but we want to at least send that message that we're trying to get to the emails and get to the phone calls every day, because it's the same thing that what we would want in any business that we dealt with. And so that's the point there. And I apologize. I thought the phone reimbursement was here. If you would be so kind as to remind me, what was the state policy on the phones or cell phone policy, please?
Sure. Let me.
And while Daryl's looking that up, there is the possibility that demand exceeds capacity in
Yes.
terms of, emails and phone calls. And so while I agree with our customer service needing to be the best it can be, back to John's point, not at the expense of those delaying folks who've been waiting ages to get their licenses.
George,
it's really about allocating resources.
George, let me tell you my fear on kind of what you're suggesting on the phones, and then you argue the counterpoint to me. If I pull people off of processing, let's say I pick the least efficient people for processing applications and I put them on phone duty. What do I do with that excess workload since everybody else is already maxed out?
Right.
Well, I don't know that there's excess workload. I mean, you have everybody working, doing everything they can right now. The only thing that I'm suggesting is that you reallocate. There's more work than people. I think we both agree on that. And so what I am suggesting is that we reallocate on the type of work that people are doing. So yes, there is the real possibility, instead of processing 12 applications a day, if you pull somebody out, you might go to 9 applications a day. That person might be only doing 3. The thought is that person is the least efficient, and so you should not see as much a hit from pulling them to handle the phone calls. At the same time, by handling the phone calls, you now serve that public need that we heard so greatly in the last meeting, where, I mean, you had a person crying because they couldn't get through and understand where their application's at, and they didn't know what was going to happen with their job. And there's just no reason that we should be putting people to that level of stress. People recognize that we have an issue. People recognize that we're doing everything possible. Your team's doing everything possible. I don't think there's anyone who believes that's not the case. What the case is, though, is that we have to communicate. The lack of communication is not an option to say that we're going to do work over communication. That does us no good. We have to be able to communicate. And maybe we don't communicate to the level that we like, but we've got to start at a level higher than 1 day a week.
Am I on mute? No, I'm not on mute. One thought here. I mean, I'm right now working on getting our corporate real estate license renewed with the Real Estate Commission, and they're running slow on processing documents, and they're not getting back to me. But they do post on their website what date that they're working right now, and so I can go look at that. But there's definitely precedent for other agencies to prioritize the actual work other than communicating. And I'm not excusing lack of communication, but I appreciate the fact for my license over there at the Real Estate Commission that they're prioritizing the work and not communicating with me. And I can go to the website and see what date they're processing stuff from submissions of documents. So.
But that's a form of communication, John. By them putting the date out there, you know, and that's what's causing you to calm down, not be as stressed out about it, because you can physically see where they are. Our constituents are not able to do that. There's a big difference. I mean, you're getting communication.
Well, actually, I do list on our website where we're at on the processing. I have
going backwards or going forwards with the pincher method?
It's the dates of new applications we received. Where the blind spot is where we're at in the deficiency.
Which
Right.
you've cut from
That's what I'm
800
talking about.
Yeah.
But you've cut it from 800 to 500 in a matter of 3 weeks.
Correct.
Right.
We're making progress. But I see your point.
So the question, Daryl, how close are you to how close are you to ending your overtime? I mean, how much overtime do you have left in your budget?
I don't know, Mr. Francis, off the top of my head. I don't have the dollar figure. I know that I've got,
and so the
I
question,
think I've got 7 enforcement positions that are vacant right now that we're trying to fill. And I think 3 in licensing that I need to fill. So the salaries for all those is what I have to work with. I know that doesn't help you because it doesn't have a dollar figure, but.
When does the fiscal year end?
August 31st.
So we're approximately 2 months into the fiscal year right now, or 1 month into the fiscal year, and we're burning X percentage of our overtime budget with no idea of what the rest of the fiscal year looks like, with potential upticks in COVID, with the potential of shutting things down again and people having to go and work from home. I mean, all types of things that are extraordinary that we would never have guessed that would have happened up to this point. And so that's the reason why overtime to me is never the answer, because it's not something that you can continue to go back to.
It's not a long-term solution. Yeah.
No, but it's the answer for now. After all, we've stood this agency up on September 1st. And that's when they really started working for us. So you're to be commended for that. I think, George, you're right. There is our capacity is not all it could be, but we're reaching there. So I think these ideas are good ones, and I think they're worthy of a continued discussion. And we all know that it's a hard balancing act, and that we're living in a year of extraordinary circumstances. But with your ideas, especially the points that you emphasize were the most important, and the balance that Daryl has been able to achieve with existing resources while he's looking for new resources, and asking the legislature for additional appropriations or whatever, it's more money to get more stuff done. I think we're making good progress, but I think it's important to revisit this and to keep on it, so that way we don't become the person that has or the agency that has this backlog.
Madam Chair, that's all I have.
I think what we're aiming for is professional excellence. And I appreciate your suggestions, George, and your work, Daryl, and everyone else's input, of course.
And I would be remiss if I did not say thank you both to Daryl and to the team, and to all the volunteers that have been working the issue. So I don't want it to seem that I'm not grateful for that, because I truly am. I just want to make sure that we just do the best that we can for the company. So thank you for that. What I would ask, Madam Chair, is that this continues to stay as a update agenda item on for our next couple board meetings, until we get through the crisis, until we understand the root cause of what happened, and make sure that we don't repeat repeat it. And so if we can do that, I'd be very appreciative, please.
I think that makes a lot of sense. And George, you don't come off negatively in any way.
I
can see
didn't take it as a,
Yeah.
you're an idiot. What are
Thank
you
you.
doing?
It's all constructive. Thank you so much.
Thank you. I appreciate the time you've provided me.
Sure. Let's try to get through Daryl's report on item 8, and then perhaps we can take our lunch break around 12:30. Are you all good to keep charging through another half hour? Okay, Daryl?
The first item on 8 is the LAR. As all of you know, the deadline to do that was, I think it was October the 9th. We were part of the last group that had to submit their LAR. In it, the most significant issue in the LAR is the request for, we put 3 exceptional items in it. Let me see if I can pull those up for you. Basically, the first request is for additional staffing, 4 additional FTEs. What I've asked for is 3 additional licensing and permit specialists to be used between the professional counselors and the social work board, or those licensing programs, and then 1 additional administrative assistant to deal with the, the phone calls, the emails, the paperwork, which hopefully we can move away from the paperwork as we transition to online applications. Where am I at here? 8. One of the biggest, I guess, probably eye-opening experiences I had when I was preparing the LAR is looking at the growth of the programs over the years. All of these programs are growing at a pretty significant clip. The biggest, I don't remember where it is in here, but the biggest growth.
Increase the size a little bit.
Increase
you
it.
have it at 63%. Yeah, there you go.
Okay.
Okay.
It's not the best quality of scan. But probably the most significant factor that I noticed is the growth of the LPC program over the past 10 years. And then I did a 10-year look back and a 3-year look back. Over a 10-year look back, they increased over 70%. On a 3-year look back, they increased, it was over 20%. They're growing at a tremendous clip. I mean, it's very, very impressive, the rate that they're growing. The rest of the programs are not growing slowly either. They're growing pretty significantly, all 8% and up, if I'm remembering right. In other words, our business isn't going away anytime soon. We're not seeing a recession or a retraction in the number of people that are applying or seeking this particular occupation. So, and that was one of the reasons why we asked for the additional FTEs, is obviously to deal with the backlog, but it's also an anticipation of what we see coming, because these numbers are not going to slow down. Given the mental health workforce shortage that we have here in Texas, everybody agrees that there's a workforce shortage. That's undisputed. So we need to be prepared for the influx of people that are seeking to fill those shortages. So that's another reason we sought the additional FTEs. Let me see here. Oh. Well, let me the second. I'm sorry, Madam Chair. I should have had this up beforehand. Okay, the second FTE, or the second exceptional item that we requested, has to do with the move over to the Bush building. And what an exceptional item is, for those that are listening that don't know, that's money that's over and above our baseline budget that we're requesting. So obviously, if we want to add 4 more people to the staff, we have to ask the legislature for the funding to do that. We also have to ask the legislature to increase our FTE cap, the number of people we can hire. We can't hire over a certain, whatever cap is that the legislature gives us, except under very exceptional circumstances. So we've asked for money. We've asked for a raise to that cap. We've also asked for money that's related to our move over to the Bush building once that's completed. And then the last exceptional item really isn't, we're not asking for any money. This is one, and this is probably something that I need to visit with the fee review committee about is the governor's office had requested that all agencies submit an exceptional item showing what the gain or loss in general revenue would be if we all set our fees at 75% of the national average. Some of our fees are already below 75% of the national average, and others are a little above it. Basically, the short version of what I'm trying to say is, if we did that, we actually wouldn't have to ask. We could operate the agency just based off of fees set at 75% of the national average or what we're currently charging. We wouldn't have to go get additional money from the legislature. But what this exceptional item sets out is the ledge is going to lose about two point something million from us that they would be giving up. And I think probably the purpose behind this was to show all the powers that be and everybody that sees these LARs that, look, if agencies are required to set their fees at the national average or anything less than this, the agency may still be able to continue to operate, but we're going to feel it in the pocketbook come the next legislative session. So our third exceptional item really doesn't have anything to do with us. We weren't asking for money. It was just more of an informational thing that we were asked to put in our LAR. So if anybody sees it, that's what it's there for. But it does have information that would be useful, I think, to the ad hoc fee review advisory committee that we have. So I'll visit with them later on about that. In general, that's the LAR. I don't have anything else to go over with that. The exceptional items are always the big thing there. So if anybody has any questions, I'll see if I can answer them. Okay. The next item is the update on the enforcement functions. If you'll look in your materials that I sent you, it wasn't in the first round of materials that I sent you. It would have been in the follow-up. I've given you a status report. You can see all the agreed orders that I've entered, and you can also see summaries of the cases that have been dismissed by the council. So if anybody has any questions, I'll be happy to answer those. Otherwise, that is really there for your information. We're still working on trying to figure out what's the best way to present this to both the council and the member boards. I know Mr. Francis at the LMFT board meeting the other day, we went over some of this stuff at y'all's board meeting. So I haven't yet figured out what's kind of a unified approach so that each member board can see the stats on its licensee population and also see where they fit in the picture as a whole. I'm trying to figure out the best way to do that. That'll just going to be something that we'll have to work out as we go based upon what y'all's preferences, what you like, what you don't like. We can change that up as we go. But anyway, you can see these are the numbers that we have when the cases came over. We haven't finished the first quarter of our, of this fiscal year. So I don't really have anything for this quarter, but those are the numbers.
Yeah, can I ask a question real quick? Can you tell us the name of the document just so I make sure I'm looking at the correct one?
I'm sorry. It's 8.B status report.
Great, thank you.
Yeah, and this may help because there's nothing on here that's confidential. We can share this with
the
public. Yeah, this tells you. I know when the cases came over from HHSC, y'all had a lot of stuff. The ISC panels had sent a lot of stuff over. You had sent a lot of stuff to SOA, but nothing had gone to SOA. So you can see right here, staff are going through it. Right now, I think we have about 200 cases that are in the legal division for review. Alfonso, is that right?
Yes, sir. It's over 200 now.
Okay. So you got five lawyers working on a little over 200 cases. And then, of course, you've got all these that are destined for SOA.
What is SOA again?
The State Office of Administrative Hearings.
Okay, I always forget.
Basically a bench trial. It's an agency that provides a bench trial to decide contested complaints.
So if I could just ask a question, I know that attendees of our meeting today may be interested in these numbers and have wondered if these numbers are going to be available at each of our BHEC meetings or how that's accessible. If you could answer that.
Yeah, going forward, what we'll probably do is put this in the meeting packet. The only reason it didn't go in the meeting packet now is because I just didn't have it ready in time. when the materials went out. But this is all de-identified, so it's fine for statistical stuff like this to go in the meeting packets. What I can't give out is any kind of information that talks about the specific complainant or the specific respondent. I have to
Right.
de-identify all of that.
I think the question is more, there are two questions that I'm hearing from people. They're wondering what has happened to cases that are in process that might be older. Now BHEC has inherited those and they're all part of this, is what you're saying, correct?
Correct.
Okay.
Yeah.
And then I think what they're looking at is, where is they want to see the trends. People have asked that quite a bit. What are the trends? And so what I think is an incredible thing is that now we can see across 4 boards what the trends are, just related to dismissals or pending cases, how long cases are taking, because as we know, some boards may have had worse numbers than others. And I think that there's so much hope for the resources now to be used for the benefit of all boards. So I think hopefully people will hear that message that this will be available in packets going forward. And it's certainly understandable why it wasn't in this one right now. There's a lot.
Yeah, and let me tell the public kind of how we're tackling. You see the number, the 1359. That's the number of complaints that came over from HHSC that we inherited as BHEC. I think there were 80 something that came over from the psych board. So pretty significant difference there. But here's the way we're tackling this. We're using a pincer approach here in enforcement like we're doing in licensing. We've got staff that are working on the oldest of the cases, and then we've also got staff that are investigators that are working on the complaints as they come in. Now, we don't just take the complaints in the, either the oldest or as they come in. We prioritize those complaints based upon the severity of the harm and the allegation involved. So what we're doing is, and we've assigned our senior investigators, the ones that have a lot of experience in investigating, they're tackling the high priority cases. So, and they're tackling those from the oldest to the newest. So we've got the senior investigators working on that. You've got your newer investigators who are in training or they're just very green. They're handling the lower grade offenses, and they're doing it the same way. They're tackling it, from oldest to newest. But we've also got some investigators who are tackling cases that come in, so that this thing doesn't, just because we're chewing on this end, we don't want it ballooning up over here. So we're attacking it from both directions. Alfonso, did I say that right?
Yes, sir, you did.
Okay. So we're trying to meet in the middle there is what we're trying to do. But we're also, within that, we're also trying to work on the higher priority cases so that we get those addressed first, because we don't want to tackle a records issue case when we got a sexual impropriety case floating around out there that's of the same age. We would tackle that first.
And also the priority and how things are, the hierarchy of that is available on the BHEC website on the complaint page. So if people want more explanation of that for the decision making, it's available to them at any time.
Correct. Okay. Of course, I've got in your packet the agreed orders, all the agreed orders that were entered, so that you could see what I'm doing. The dismissal summaries, you can see what cases we're reviewing and what we've dismissed. I guess that probably at some point we need to ask, do you want to continue receiving the dismissal summaries? Because those they're going to get rather voluminous on an agency this size. I'll just tell y'all right now. At some point, you'll probably need to decide if you want to get those in that particular format that you got there, or if you would just prefer a spreadsheet listing what cases were dismissed. We'll leave that to y'all to decide. I gave you a pending complaint report that shows you all the complaints that are currently pending, broken down by each board, so you can see. Obviously the LPC board has the most. It's 800 and something, followed by social work, and then trailing way off in the distance are the LMFT and the psychology board. So the LPC board, Patrick, how are you tasking the lawyers here? I know you're throwing a lot of weight at the LPC board right now.
Pretty much 4 of the 5 attorneys are working on LPC. 2 are devoted full time to LPC. Another 2 are splitting time between either the LMFT board and LPC, or also the psych board and LPC. So there's about, so I mean, four of the five are working on LPC cases.
Is there any questions from the council on the enforcement materials that I've given to you, or just questions in general about how we're tackling the backlog?
Well, Patrick, if you need me, I'm available to help in any way I can with the backlog, informal settlement conferences, whatever you need. I'm happy to help.
Thank you. We'll probably take you up on that.
Please do.
Agreed. The ISCs work pretty well. It seems like we've slowed down under the circumstances, but it does get matters cleared.
The next item, Madam Chair, on the agenda is 8C. It's the discussion. It's basically, we were going to talk about the licensing backlog, which we've already done quite a bit. I won't rehash all of that. Just to give you a heads up, like I said before, the ASWB program, we're about to launch that. Shooting for November 1st. It may be a few days after that. The issue with the recent social work rule has taken me kind of off task on that. I've also got to prepare for joint budget hearings on the 29th that I've got to testify at. So I haven't even started my testimony on that yet. So I need to focus on that. The one issue that I want to apprise you all of is, now that we've adopted the social work rules and we've got those rules packages, we'll get them over the Texas Register. They're on their way. That will now, once they've been published, that will now allow us to send over to the Register the proposed rule changes that will do away with the requirement that supervision plans be submitted and approved. That's another area that's causing a significant backlog for us, is the supervision plans. Staff devote a crazy amount of time to processing those things, and they have a very, very high, George, this would be one where you'd probably cringe on. They have a very high rate of staff finding deficiencies. 60 to 70% of them get kicked back. And I'm like, that's a problem. So that's one where I'm hoping that we can get those rule changes. We need to get those rule changes pushed through as quick as possible so that we can eliminate that problem. The one thing that I wanted to bring to y'all's attention, I think y'all knew I had requested from the governor's office a suspension in the interim while we're waiting on that rule change regarding supervision plans to take effect. I had requested from the governor's office to suspend that rule so that we could, in effect, just go ahead and stop having to process those things. That request has not been granted yet. What has been asked of me is a more detailed analysis between, I need to connect the dots between our request and COVID-19, which forms the basis of the request. In other words, I'm basing the request off the COVID-19 declared disaster. The OOG is wanting a more detailed analysis on how to connect the dots between my request and the COVID-19 disaster declaration. Candidly, guys, I do not have time to do it right now. It's a homework assignment that I don't have time to do right now. So I don't know that will get done before the rule change is actually adopted. But I'm doing what I can there. So I'm just kind of giving y'all an update on that.
Carol, I have a very quick question. There were some public comments at the last meeting from actual supervisors who said they would be willing to assist. Is that even allowed for volunteers in that capacity to help with the supervision plans in the interim?
Yeah, you could. I'm almost a little hesitant to waste man hours on the supervision plans, because I feel like the social work board will recommend adoption of those rule changes. I'm not expecting a lot of pushback from the community on it, and I don't see this body saying no to it, since it's going to solve a big problem. Now, maybe I'm a little arrogant in all those things, but I'm just hesitant to bring people in and have them view it as, well, you wasted my time. That was a wasted weekend. So,
I just know it was offered by some supervisors in our public comments. And so if I can just make sure we have this correct. So the social work board's next meeting is December 4th, correct?
I think that's right. Yes.
Okay, I looked it up on the BHEC website.
Okay.
And then our next meeting for BHEC is January 12th. So the expectation is, the way the process works, January 12th, it would come back to us after being at the social work board and approved, hopefully. Is that what we're looking for?
Correct, correct. Ideally, though, Dr. Fletcher, what I may do is do a joint session between this council and the social work board on December 4th. If I have it ready to adopt, if I could just get a quorum of y'all together on December 4th with the social work board, we could just do, you guys could meet just for the purpose of adopting that, and then they could go on and do the rest of their business on the day. So we wouldn't have to wait till January.
That's a great idea.
I'm probably gonna push y'all to meet as quick as possible there if I can get 5 of you together.
Got it.
The timing might be an issue though, based on publication. We have to wait for the changes to be adopted before we can publish those new rules. So I don't know the answer to the timing though, but you're right.
If possible, yeah.
If possible.
That's all I have on the licensing backlog update, unless anybody has any questions. The next issue is the Q&A feature in these meetings. I know at one point, like today, I don't have the Q&A enabled because I expected a pretty high volume on here. I was not going to be able to man it. I visited with Chair Canseco. She said it was okay that I disable it for this particular meeting, but we need to discuss whether or not we want to leave the Q&A function on during the meetings. They're not public comments. I don't have time to man them and respond to them. I don't know. In other words, I don't know how y'all want to use it. If you want to keep it turned on, I don't know how you want to use it.
My concern was that it was distracting for all of us. So we're reading Q&A while looking at an agenda, while looking at the accompanying paperwork, while looking at each other and discussing the topic. You know, I think that might be too much to handle. As long as there's still the opportunity for the public to comment when we're on these virtual kinds of meetings. I think last time you recognized them through the chat feature. Is that right? Not the.
No, they just use the raise hand feature.
Okay.
Is how we do
As
it on
long as
public comment.
folks can still speak when they're ready to speak, I think the Q&A feature is quite distracting. Perhaps I'm alone in that. What is your feeling?
We all turned into bobbleheads, Chair Canseco, when you said that. Yeah, I think we agree. I agree. I don't speak for everybody else, but
okay. Any dissenters? Yeah, let's keep that off for a while.
Okay.
Someday we're going to return to person meetings. Won't that be exciting?
Oh, that brings up, I'm glad you said that. That reminds me, the governor's office has lifted the ban on domestic travel amongst agency staff personnel. So you can begin begin traveling back to Austin to meet if you want. Now you get here and the building, I don't want to say the building is shut down to the public because that's not a true statement, but where and how we would conduct a meeting in person right now under the particular, the circumstances of quarantine and all that, social distancing is a whole other matter that y'all are going to need to talk about. But if you want to,
do this until the new year at the very least. Some of us are at higher risk than others. And I like the better safe and sorry attitude. This doesn't seem to be intruding on how we conduct meetings or how effective we are. So why don't we take that up in December? Make a decision then. I hope we'll see a drop in December. So item E, 12E, we're 2 more letters and we can take.
Actually, I need to withdraw item E, Madam Chair. In visiting with some other government lawyers, I'm just withdrawing that. I don't have anything.
Okay, and so item F. Issuance of renewal permits, 12F, 8F.
Okay, we talked at our last meeting about why are we still issuing paper renewal permits when you can find out all of that same information through the council's online verification system. One of the questions that came up was, well, is it required for like Medicaid? So I looked up the Medicaid provider manual, and that's what you have in your materials there. Let's see, where's that at? 8F in the materials. I can't see I mean, according to the materials, and I'll share it here. I can't see where it is required that you submit a renewal permit. I don't know why a person could not rely upon the primary source verification of our website or the printout from that website. I know not doing renewal permits would save us a lot of man hours because, and I know Mr. Francis is going to throw a rock at me whenever I say this, but we are manually stuffing those things in envelopes and mailing them. And we would save a fortune in postage and just to save a ton of man hours if we didn't have to do that. For the life of me, it does not make sense to keep doing paper renewal permits. It wouldn't require a rule change. You could simply say, stop doing them because it's not in rule anywhere. We don't require that the renewal permits be posted with the license. That's not in a rule. Unfortunately, it's printed on the renewal permit, but it's not a rule requirement. So we don't have to change any rules to do it. So what I'm asking for is y'all's permission to stop printing renewal permits and direct people to the website if they need verification of their licenses.
Do I have a motion to the effect of Daryl's request to discontinue issuance of renewal permits up by paper and to begin directing people online? Is there a motion?
I'll make the motion.
Okay, Dr. Fletcher made the motion, I think. I didn't have the screen on correctly. I see John
Second.
seconding. Thank you. Is there any discussion on the motion?
Discussion, please, Madam Chair, if you don't mind.
Sure.
So it's not in rule. What do people use it, or is it just a notification for them, or why have we been doing it? What's the purpose of previously?
I'm going to let some of the licensees answer that, see what they used it for.
Patrick?
I was just going to add some of the older rules that have now been taken off the books once we've adopted LPC and social work used to state you must display your renewal permit, but those rules don't exist anymore once these get adopted on we send the LPC and the social work to the register.
Including for LMFT? I'm sorry.
Well, I was just going to add that there are instances where a licensee is expected to make a copy and send it because there's other organizations that are still dealing with paper more than electronic. And so sometimes it's just in response to a request coming that way. I haven't had one of those in quite some time, but I do know that I would keep extra copies because I would need to send it for some reason.
Of your renewal or your first?
Documentation, I would send what is stuffed in an envelope mailed to me from the board. The little one and the big one.
I will add that we will retain the ability if somebody needs one, they could order a copy. But as a matter of practice, I don't want to be printing them out and mailing them.
Agreed.
Dr. Bateman, is there anything in LMFT that requires us to use it or need it that you know of?
I don't believe that it's needed now, especially with the online verification. It's so much easier just to go online, verify whether the person has the license. I think that's all that's needed at this point.
Be done with it.
Yeah, same with LPC. Mine just sits in my desk. I don't ever do anything with it.
Historically, for the social workers, we were supposed to post it wherever we practice. So if one of our clients had an issue, they would be able to see that we were current and or see where they could file a complaint. But as others have stated, that's easily obtained online now at our website.
So what it means is the days of the pretty frame at the back window when people were leaving the office that housed that are over. We don't need that anymore. And Mr. Francis, if you would have liked to have made that motion instead of me, I would give you that opportunity to substitute that if you would like.
Oh, you're kind, but I'll let it stand. You're good. You're good.
I think then maybe if there's a call to question, we can go ahead and vote if there's no more discussion. Anyone?
If we may, please, Madam Chair.
Thank you so much. And all in favor of discontinuing issuance of renewal permits and directing folks online?
Aye.
Instead of hi, okay. Any opposed, same sign? Motion passes unanimously, and it is 12:29. You guys are something. We're right on time. On October 27th, I propose a half hour break so folks can get lunch. And I suggest that you actually physically get up and walk around and get your blood going for the next half of the meeting.
Madam Chair, are you wanting everybody back at 1?
I think at 1 o'clock would be great. Okay. Is that all right?
Good.
Okay, let's break. Thank you
All right.
so much. Do you want me to start the recording?
Sorry, Madam Chair. If you could
That's all
state
right.
the date and time again.
Sure. It's October 27th, 2020, 1:06 p.m. And the meeting of the Texas Behavioral Health Executive Council is back in open session. I believe that we're on item 9. And it looks like
There's no business to do on
there's
9.
no business under, all right. There's no business on item 10 or 11.
Correct.
And we have completed 12.
Correct. And there's no
Which is
business under 13 either.
13. Well, isn't that nice? Okay, then we're on item 14.
That would,
And I can't remember who's the ad hoc fee review committee.
well, there's, I think Dr. Fletcher, Mr. Belemowitz, Mr. Francis and Chair Brown are also, I think they're on it. Oh, you're not on the ad hoc fee? Okay. I know Dr. Fletcher is. I know John Belemowitz and Mr. Francis are.
I think Mr. Francis is unable to join us again until 1:30. I got a quick note from him.
Okay.
So does anyone from the ad hoc committee care to speak?
Sure, say John is joining us right now.
Okay. Is he the chair?
They haven't selected a chair.
Okay.
Can you guys hear me?
Yes, sir.
We can now.
Okay, hang on a second here. Beg your pardon for being slightly tardy here. Hang on.
That's okay.
Trying to get my hands free to work. We'll go without it. So the ad hoc, we're talking about the fee committee.
Yes.
Yes, sir.
We've established the committee. We've not yet met. And now that we've established the committee, we will be setting a meeting date, I imagine, here in the near future. But that was the last thing of figuring out who the stakeholder organizations, who they were going to send up. And we do have those now. Daryl, am I forgetting anything on that?
Nope, that's it.
Okay.
We're lacking one stakeholder, and that is a representative from TAMFT, Texas Association.
Could you remind us who the other stakeholders are?
Sure. It is, it's either Miss or Dr. Catherine Bacon for the TCA, the Texas Counseling Association, Todd Linder for Christian Counselors of Texas, Jessica McGee for Texas Psychological Association, Norma Salazar Cortez for the Texas Association of Psychological Associates, Stephanie Barbray for Texas Association of School Psychologists, Will Francis for National Association of Social Workers, Texas chapter, and Kathy T. Ryder for Texas Society for Clinical Social Work. And then I believe now that Ms. Chair Smotherman has rotated off both the LMFT board and the council, I think, and I need to visit with Mr. Belemowitz and Mr. Francis about this, but I think she is also going to be, we'll just say, reconscripted as an at-large member for this committee as well. So she just thought she escaped our grasp.
I think she may have been watching earlier. I did get an email from her. I didn't get a chance to look at it yet. So if she's listening,
She already
Yeah.
told me.
Do you know she's getting pressed back into service?
She knows. She already got the papers.
Good. Okay, good.
He texted me as well. It'll be nice to have her on board again. Okay, thank you, John, and members of his committee. Next is reports from the member boards regarding current or future issues that may impact the profession or the agency's regulatory functions. So shall we begin with Susan with the Board for Psychologists? Susan, I think you're on mute.
There we go. We don't have anything to add. I don't have anything at this point.
Okay. Who's next? Professional counselors?
Nothing at this time, Madam Chair.
Thank you. Tim, social workers?
If you don't mind, I don't have anything addition than what we've already shared and talked about today. But if we could, I think there's been some confusion, people listening, not understanding 100% what we did earlier today about the 781.201.
Sure, go ahead.
Daryl, I believe that, and correct me if I'm wrong, the council has determined to not accept the removal of sexual orientation, gender identity, and expression. So the 781.201 would go back into place that was prior to the announcement of changing it on the 12th of October.
Yeah, the operative language that everybody was concerned about is still in the rule. In fact, let me show you what was published in the register so that everybody can see what we're talking about.
And for those who can't see, who can hear it, but who can hear it, disability as well, right?
Correct.
Okay, do
Yeah.
you want to read that as well?
781.301, that is the rule that we have chosen to adopt. That is the rule that was published in the Texas Register. Here is what it reads under subsection 1 of that rule. A social worker shall not refuse to perform any act or service for which the person is licensed solely on the basis of a client's age, gender, race, color, religion, national origin, disability, sexual orientation, gender identity and expression, or political affiliation. That is the exact same language that was found in 781.201, the original rule. We've had to move the rules location as part of the reorganization of the social work board rules, but the substance of that particular provision is exactly the same. Nothing's changed.
And that is the rule that will be published.
Correct.
And just for
Go ahead, Tim.
clarification on a technical measure, does this have to go back and be approved at the social work board level?
No, sir.
Okay, thank you.
It will, as soon as we send it over to the Texas Register, it'll be in the law. Nothing will have changed.
Okay, thank you very much.
And if I could just ask, related to that clarification, there's already been news coverage on the events this morning in our meeting. And
Yes.
so there's a question related, well, I think there's some confusion. People are wondering when this will start again. So it's as if people think that something changed between October 12th and now, and they're wondering about people who may have discriminated in that period of time. So Mr. Spinks, if you could clarify whether anything changed in that period.
Not a thing. There has been no gap in the prohibition on discrimination. If somebody has discriminated against, if a social worker has discriminated against somebody based upon any of those grounds in that rule, then they can file a complaint and the board will prosecute that. But there has been no gap in the prohibition against discrimination. So if anybody's saying otherwise, they're wrong.
Okay, so just to be clear, on October 12th, what occurred in our meeting and what occurred in our meeting today, nothing changed at all related to discrimination on the areas we've already outlined.
Correct, because we never did publish the rule change that we adopted on October the 12th. I did not send that over to the Texas Register. The change did not take place in the law, and you revisited that decision here today, and you have reversed that decision. So the law remains the same. There has been no gap in the coverage.
Thank you for clarifying.
And thanks to the public who brought that to our attention before the close of the October 12th meeting. It may not have happened had it not been for those who spoke up. Thank you, Susan. Any other comments or remarks before we proceed? Did I miss, let's see, social work, family therapy? I feel like I missed somebody. Did every member board get an opportunity to comment on current or future issues that might impact the agency's regulatory functions?
You missed the marriage and family therapy, but we have nothing to add at this time.
Thank you. The recommendations for the agenda items for the next council meeting. As we wait for Mr. Francis to come back, I want to underscore the importance of looking at processes. I think those long-term approaches are good, and I think it's supportive of our work and helping us to aim for professional excellence as a board. Well, elegance too, I guess we'll take that. Is there anything else that folks would like to see us visit or revisit at the next meeting?
I don't know if this would be an agenda item. I just want to, we all understand that we're in a transition and that there are things that are in the rules right now that are active that will continue to need to be revisited, correct? Okay, they say that the right way. So I know that there's some confusion in terms of the complaint process. So I don't know if it needs to be an agenda item for next meeting or just clarified now. There are one or two questions that have come up and people don't know the avenue to get those answered.
What do you recommend, Susan? What would you prefer to see? Do you want us to
Well,
discuss now?
I think it can be brief if we're willing. Is that in terms of someone who has a licensing complaint, there's an understanding from reading, and I will pull it up in a second. It starts with an A, and it's a BHEC rule that do people only have 30 days from the time that they're told they have a complaint to provide a response?
Are we talking about a complaint filed by somebody against a licensee, like a disciplinary complaint?
Correct.
Yes, the typical response time is 30 days.
Okay, when you say typical response time, is there a requirement?
In the actual notice of the violation, we will tell them you got, now, upon receipt, you got 30 days to provide a response to this.
Okay.
That's where it's found.
It's 884.110B, 884.10B. So, so they have 30 days to secure, if they want to secure an attorney, if they put together a packet as a response, they need to do that within 30 days?
Correct.
30 business days or 30 calendar
It
days?
just says 30 days, 30 calendar days.
Okay. I think there's a concern that's a short period of time for people to schedule meetings, find an attorney, put materials together to give a response. I just wondered if that's what it's always been. And when we're looking at 4 boards now, whether or not that's what the experience has been.
30 days is a very typical response time you'll see scattered throughout the law. You see it all over the place. I will say, if council reaches out and says, look, I just got this thing yesterday, they just came into my office. Can you give me another 15 days? Generally, we're pretty good about that.
Okay.
You generally get a blank check on your first one. I'm probably going to regret saying that in an open meeting, but once your second great uncle has passed away, at that point, we stop being we're not as liberal with the extensions after that.
Okay, so it's really the communication and response that's important in order to make sure it doesn't look like it's being ignored.
Yes, but what we have to guard against is people just constantly asking for extensions, and then that kills us on the performance measures, because remember, we're being judged by how fast we resolve these things. So we don't want to just let it go on indefinitely.
Okay, that's all I needed for clarification. There was just with the changes in the transition and trying to have things be consistent for all boards, there was some confusion about that. Yeah. Okay.
And in that vein, thinking along that line, I think it would be smart for member boards to look at their definition of days, because calendar days and business days can be quite different and can, knock 6 days potentially off of a complaint resolution time. Anything else? Do we need an agenda item to decide whether we want to meet in person? I really think we should reach consensus about that as a council, or should we simply put it as a discussion item?
I have in my notes that you wanted at the December meeting a discussion of whether or not to resume in-person meetings.
Okay,
So I was going to put that on the December agenda.
I think that makes a lot of sense. Do you all agree? Consensus? Yeah, okay. Anything else coming up? Okay. The next item is public comments. I want to remind the public that in order to be called on for a comment, please use the raise hand function on Zoom. I see that we have 6 maybe. And yeah, I see folks. Okay, I guess you heard me. And we will take them to, let's see. Public comments are normally limited to 3 minutes each. And depending on the volume, I'd like to say in advance that should the public comment period extend well into the afternoon hours, I will close the meeting at 5 o'clock at the latest. In the interest of council members' time. Daryl, if we do close the meeting at 5 o'clock, do we reconvene, or how can the rest of folks comment if they still want to keep talking?
We would have to reconvene the following day. The problem with that is the particular link for this webinar. I don't think it won't carry over to the next day. In other words, I can't revive this webinar link. So that's problematic in that a different link would not have been posted.
Okay, so
I just want to, if I can add one thing real quick on this, we've gotten a lot of written comment and I've read all of it, and saw the passion and great legal arguments that all went into a lot of my thoughts on this, and hearing from that, we got here all better together based on the public's input. So I think that's worth putting on the record ahead of going into comment. Your comments worked. Brevity is the soul of wit. It helps, especially when there's a lot of people that want to speak their piece, and we appreciate it and want to hear it.
That sounds great. And John, I wanted to make sure when you commented, I'm thinking back a moment to make sure we've covered everything. And we just went over what we passed with regard to the discrimination issue. Your comment was regarding that 507-153, the occupations code. Is that right? The part about the ethical standards and the.
I was, are you talking about what I was citing ahead of my motion?
The motion that, yes.
I actually, I forget whose comment it was. It was from one of our legislators, was referencing section 505.
Gina
Section
Hinojosa.
50, there's a, okay, yes. And looking at 505, I'm looking at what it talks about in terms of, I still have my notes here. Board shall propose to the executive council rules regarding, and then it talks about ethics.
Right.
And
Ethics,
even
scope,
ahead
and
of
standard of care were the 3 things.
correct, and even ahead of the rule, it specifically talks about. It was on the screen earlier when Daryl had it up. It talks about the ethics, and here's the standards. So that was. Did that answer your question?
Okay. Yes, it does. Daryl, I thought my notes say that we looked at 507-153. Did I miss something there? What is 507.153?
507-153 is the limitations on the council's ability to propose and adopt rules. It says that rules that deal with the scope of practice, codes of conduct, and ethics have to originate in the member board. They can't originate at the council level.
All right, so that might be aligned with John's question.
Correct, it dovetails with what John.
So perhaps when that question is posed, we can mention that both rules address similar issues and make sure the clarification is even more clear. Would that be all right? Does that have to come to in the form of a motion, or do we just assume the Attorney General will look at that?
No, no, we would include, those statutes will necessarily be included in the request of the AG. All of that has to, yeah, we'll have to put all that statutory framework in there
Okay.
to outline what our limitations are.
So for the public, we will be posing that question to the Attorney General and hope for a quick turnaround, but 30 days ought to do it. Let's see what happens. Thank you so much. Then if there's no further discussion, I'd like to proceed to public comments. Is there any further discussion from council members?
I just want to add one more thing, is that the National Association of Social Work Texas chapter held a press conference last Friday, and I know I attended it live and heard the speakers and listened very attentively. And also the link for that playback has been provided to council members, and I know that council members have taken the time also, and I see some of the names of people who spoke in the public comments, and so I'm not discouraging them from making a public comment at all today, but I want to thank them for the opportunity, and others for having provided ways that council members could listen to the public outside of this forum. So I just want to acknowledge that was something that we were aware of, and each of us individually took the time if we were able, as well as other avenues to hear the public comments.
And I'd like to compliment the staff for continuing to keep us informed. Not only did we get that link, but on a separate issue, we received a link from Daryl et al. It wasn't about the discrimination policy, but it was about something else that came up. Maybe it was the backlog. And every piece of mail, every email that is sent, I know I received over 600 emails sent to us. I want you all to know as stakeholders that staff does send us every single page. And I'm sure I speak for everyone. They say we read as much as we can. I certainly went through each one. So thank you for that. If there's nothing else, I'll call on the first speaker, Paula Bowles.
Madam Chair, if
Yes.
I could suggest that we maybe start with our state associations, since they're going to cover kind of a broad swath, and they might cover some topics that other commenters were going to say, and it might help shorten.
Sure, then let me let you take the lead. You can see the raised hands there.
Yes.
We have 29 right now, so go ahead.
Correct.
Well,
Okay.
thank you.
Mr. Francis, if you could state your name and who you're representing.
Yes, thank you. And I appreciate the opportunity to testify. My name is Will Francis, and I'm the Executive Director of the National Association of Social Workers Texas chapter. This is my umpteenth draft of this testimony based on y'all's work, and I am really tried to cut it down, I promise. Really, all eyes in this country were on Texas. Letters poured in from state legislators, representatives from the Texas delegation in Congress, some of the largest mental health providers in the state, other advocacy groups and organizations, and a huge number of concerned social workers and others in and out of Texas. The Change.org petition that we started has over 24,000 signatures, and the appearance of Senator Menendez and Representative Gonzalez highlighted just how important this issue is. And BHEC heard, and we are so grateful for the vote to keep the anti-discrimination protections in place. Thank you. This is a recognition of the key principle that a social worker's personal beliefs must never impede a person's right to self-determination or access to services. You will hear from a multitude of social workers and others today expressing their concerns about what this meant to their work and those seeking services, both voluntary and involuntary, and the fear a person may feel if they believe they can be discriminated against. I encourage you to listen to each person testifying, though it may be a long day, as all of their perspectives and views are unique. Much of the testimony was likely written when the change was still looming, but it will all reinforce why the right decision was made by BHEC. Lastly, I know that the backlog on supervision plans is still looming. I'd like to thank Chair Brown for his volunteer work on this issue, and we'll work with Mr. Spinks on referring more volunteers. Thank you again for affirming that anti-discrimination protections are integral to the Social Work Code of Conduct and the opportunity to speak today.
Thank you, Mr. Francis. And I hope that it's clear that for members of this council, that was our intent from the beginning in October 12th. The media distortion did not help the matter. I think we made it very clear that we thought we were doing the right thing. Thanks, I sure appreciate that.
Okay. Next up is Jan Freeze. Ms. Freeze, if you would state your name and who you're representing.
Yes, my name is Jan Freeze. I'm the Executive Director of the Texas Counseling Association, representing close to 7,000 professional counselors in an array of work settings across Texas. First, we very much appreciate your action today to adopt rules that make the long-awaited title change to LPC Associate, which much more accurately describes licensees who have graduated, passed all licensing exams, and are accruing additional supervision hours. We are dismayed, however, that the Rule 681.13 prohibiting the LPC board from discriminating in its regulatory duties has been removed. We recognize that all but 2 members of the LPC board voted for that change, despite public comment to retain it, and that BHEC just endorsed the action of the LPC board. We think removing those protections for licensees sends the wrong message, however, and we welcome the opportunity to work to reinstate it. We very much appreciate the action you took this morning to reinstate the original social work rules to protect against discriminatory actions by social workers. TCA stands with NASW Texas and all those who spoke against reducing client protections. That said, I have serious concerns regarding requests to the Attorney General's office for authority that is clearly stated in statute, both for the boards and BHEC, regarding establishing ethical standards of conduct for licensees. The purpose of each board's rule review was to align processes and remove rules related to administrative tasks now assigned to BHEC. The 2 changes to the LPC and social work rules had nothing to do with reassigning tasks or restraint of trade and competition. Those rules establish important protections. They've long been in place and underwent rigorous legal and public review prior to their adoption. There is no justification for either of these rules to be reviewed, never mind repealed. It sends the wrong message. BHEC was created to be a model for regulatory efficiency. With that goal in mind, our associations worked hard to create this council. The authority in statute to establish ethical codes of conduct was intentional. It is stunning that in less than 2 months since its launch, LPC and social work rules long in place to protect both licensees and their most vulnerable clients would be so quickly considered to be abolished or even called into question. BHEC's role is to create licensing efficiencies and ensure rules do not restrain trade and competition. Abolishing rules that protect against discriminatory actions and even requesting an AG opinion to see if you have this authority is an extreme overreach and of deep concern. BHEC has the potential to be great, but it will take a strong will, decisive action, and confidence in your authority to protect both licensees and the public, to address inappropriate rule challenges by external entities, as well as the huge backlog being experienced by LPC and social work applicants across Texas. I implore BHEC and each of the boards represented here to continue to work with our associations to make things right, to protect licensees and the most vulnerable among us, and to create that model agency we envisioned by House Bill 1501. Thank you.
Thank you, Ms. Freeze.
Okay. All right, Ms. Ryder, if you would state your name and who you represent.
I'm Kathy Ryder. I'm the Governmental Relations Chair for the Texas Society for Clinical Social Work. We are a state affiliated society with the Clinical Social Workers Association of America that represents 250,000 clinical social workers. Social work is the major provider of mental health services in this country. We want to say thank you for your prompt action, and we do hear, Madam Chair, you restating that it was never the intention of BHEC or the Social Work Board to remove protections for any group of people, and we appreciate your prompt action. I do agree with the Executive Director from Texas Professional Counseling Association with regard to AG opinion. I think legislation both with House Bill 1501 that created BHEC, as well as Senate Bill 1995 that gave review of agency rules to the governor's office, are very clear that scope of practice, qualifications, standards of practice, and codes of ethics remain with the member boards and should originate there before they come to BAC. But we appreciate all the hard work and we appreciate the responsiveness. Legal regulation exists for the sole purpose of protection of the consumer. And you have reaffirmed that today, and we appreciate that. As a comment on some of your other agenda items, I appreciate that some members of the council may not be aware that BAC was established to address administrative inefficiencies that the Sunset Commission had put forth. And one of those was certainly the backlog of applications and complaints, particularly with social work and licensed professional counselors. So we do appreciate that you need to look at that, and that really, those backlogs came from lack of funding for additional staff to address those issues. And we appreciate all that Executive Director Daryl Spinks is doing to address those issues, and certainly Chairman Brown for giving his personal time for this. So we do thank you for all of your work and look forward to continuing to work with y'all.
Thank you, Ms. Ryder, and thanks for your partnership.
Dr. Stanford, if you could identify yourself and what the organization you're representing.
Thank you, Daryl. Dr. Paul Stanford with Texas Association for Marriage and Family Therapy. I appreciate the opportunity to speak, Madam Chair Canseco, distinguished members of the Behavioral Health Council and staff. I will, like the others, have revised this statement quite a bit, so I'm going to save you a lot of time because about 2/3 of it is no longer relevant. I want to commend the council on doing one of the things that we were going to suggest, which is really work together with the boards to better determine what rules are appropriate. And of course, check with the Attorney General's office to make sure that they are in line with any statutes appropriate in the state of Texas. I do want to take this opportunity to briefly just share with you the MFTs in the landscape. I know a lot of times for the public, the idea of mental health and the different boards can be a bit confusing. So I want to make sure and clarify MFT's position in that landscape. As you may know, TAMFT is a professional association of nearly 1,000 mental health licensed members, many of whose members are cross-trained and duly licensed. Our role is to represent our members as well as advocate for the practice of marriage and family therapy across Texas, which includes another 2,000 or so licensees outside of our membership. A couple of relevant data points given our context for public comments on this rule and the actions taken thereof. LMFTs were first licensed in Texas in 1991 and are recognized as one of the 5 core mental health providers in the United States Department of Health and Human Services, along with clinical social workers, psychiatry, psychology, and psychiatric nursing. Today, there are a considerable number of rigorous training programs at 19 Texas universities and multiple other online programs that are preparing future licensees to help meet the growing demand for services by qualified mental health providers in Texas. The practice of MFT is a unique and distinctive mental health discipline that evolved over decades of interdisciplinary research and treatment innovation. The defining attribute of MFTs is the conceptualization of humans as relational beings, best understood, assessed, and treated while taking relational factors into consideration, utilizing a family systems approach to therapy. The uniqueness to the MFT license, like the other mental health professionals, is properly reflected and organizationally structured in the passage of HB 1501, which established the BHEC and statutorily preserved independent rulemaking authority of the licensing boards to oversee and govern specific, unique licensure issues related to qualifications, scope of practice, standards of care, and ethical practices, including continuing education requirements for licensees. That's in section 507.153. TMFT works very closely with the National Association of Social Workers Texas Chapter, the Texas Society for Clinical Social Work, the Texas Counseling Association, the Texas Psychological Association, and others on a variety of state policy and regulatory issues designed to facilitate access to care and to protect the health and safety of the public. As part of the regulated community for over 29 years, TAMFT often shares its views through the public testimony process, which we believe helps inform our respective professional licensure boards on a range of substantive matters through constructive deliberation and input, as they seek to faithfully fulfill their appointed duties by setting and enforcing appropriate qualifications and competency requirements, as well as establishing specific ethical and professional standards, which also includes the ability to modify, suspend, revoke, or discipline license as needed. As I said, we had several recommendations, but those are no longer relevant given the actions of the council. And on that, I want to commend you for those actions, and I want to thank you for the opportunity to comment today.
Thank you, Dr. Stanford.
Ms. Martin, if you would state your full name and who you're representing.
Yes, and good afternoon. My name is Sandra Martin, and I am chair of the Governmental Liaison Committee for Christian Counselors of Texas. I want to briefly refer to something that was said earlier in the meeting in regards to the massive and sudden response to the action that was taken on October 12th. There was a comment made that there was a death threat included, and also someone was called a coward, and who knows what else was in that slew of response. But I have 3 points to make. One, study after study demonstrates that the most critical element of healing in the counseling context is the unique relationship that unfolds between counselor and client. The overarching concern of that relationship is always and ever, how do we serve the best interest of the client? It must be that in the confidentiality and mutual understanding that comes with a continually unfolding relationship, that counselor and client together determine what are the best interests of the client and how are those interests best served. Number two, there is a prohibition in the Texas statutes against discrimination against race, religion, sex, color, national origin, political affiliation. So we cannot discriminate against Germans. So the question would be, is it okay then to discriminate against Italians because they're not specifically named? Can we demonstrate it? Can we then discriminate against Jews, but not against a Mormon or a Christian? Again, those things are not specifically named. We cannot discriminate against Black people. Can we then discriminate, however, against white or brown people because they're not specifically named either? The broad question is answered no in all of the particulars. And so I wonder about the simple word sex used in the Texas statutes. Would the broad prohibition against discrimination include the many particulars of sex having to do with such things that we are concerned about? Gender identity, gender expression, sexuality, transgender people, and so on and so forth. And my thought the answer would be yes, even as the simple words national origin, religion, color, etc., include many particulars. In any of these categories, the particulars would build an endless list. So it is with the sex category that is included. So I looked to see if anybody agreed with me, and I found many on many different network pages that agreed with that issue, and brought me to the third point. The LGBT plus, there are many of them, communities want very much to come into the mainstream of our culture. So my question is, how does it help to set them apart as unable to function without a demand for special protection?
3
Would
minutes.
it not better honor a desire for inclusion by bringing that community and all that it includes into the mainstream prohibition against discrimination defined in all of its particulars by the simple word sex that is already there? And that basically is all I have to say. I love simplicity. Thank you very much for hearing me. Appreciate your work. Value it greatly. Thank you.
Thank you, Ms. Martin.
Ms. Mooney, if you would, state your full name and who you represent.
I think you're muted, Ms. Mooney.
Megan.
There we go. Okay. Thank you for unmuting me, Mr. Spinks. So good afternoon, Chair Canseco and members of the council. My name is Dr. Megan Mooney. My pronouns are she, her, and hers, and I'm the current president for the Texas Psychological Association. I sincerely appreciate the vote this morning by the BHEC to keep the social worker's original rule in place. I also appreciate Mr. Balamowitz's motion and the council's approval of the request for an opinion from the AG as to why the statutory authority given to the BHEC would not include the ability to approve language that prohibits discriminatory behaviors by licensees of any of the boards under BHEC. Although psychologists do not yet have comparable language in our Texas board rules, we have our code of ethics from the American Psychological Association, which asserts that in their work-related activities, psychologists do not engage in unfair discrimination based on age, gender, gender identity, race, ethnicity, culture, national origin, religion, sexual orientation, disability, socioeconomic status, or any basis prescribed by law. In fact, APA asserts that there exists essential incompatibility between APA's existing policies and discriminatory laws, policies, and practices that seek to limit the rights of individuals, including but not limited to sexual and gender minorities. In the profession of psychology, we're charged with using science and data to drive our decisions regarding providing appropriate care, treatment planning, and public statements. As BHEC moves forward with consideration of enacting rules related to professional standards of behavior, I'd like to share with you all that we have ample evidence to suggest that perceived discrimination based on factors such as gender and sexual orientation is linked to a variety of negative physical and mental health outcomes. But it's not just that discrimination in our communities and daily lives is of concern. There's evidence to suggest that there are negative impacts of state-level policies, such as the ones being discussed today, on the mental health and well-being of citizens. For example, research shows that LGBTQ people living in states with social policies that did not extend protection to LGBT individuals have significantly higher rates of multiple psychiatric disorders, including depression, anxiety, and PTSD. APA advises psychologists seek not just to do no harm, but also to do good. In that vein, APA has provided that there's an emerging body of research suggesting that non-discriminatory or equalizing legislation has significant positive implications for LGBTQ+ people. That is, the absence of discriminatory policies is not enough. Rather, policies must be put into place which codify protections for LGBTQ+ people into law. Thus, the new consideration discussed by BHEC today to adopt language prohibiting discriminatory behaviors by licensees could potentially help the mental health and well-being of Texans simply by enacting such rules. Earlier this year, APA issued a formal resolution stating that APA reaffirms its opposition to discrimination against LGBTQ people and will take leadership role in actively opposing the adoption of discriminatory laws, policies, and practices, as well as advancing equalizing laws, policies, and practices. In the past 3 years, I've had increasing conversations with my young clients about politics and the changes to laws and policies that specifically negatively impact LGBTQ+ people in the United States and Texas.
You're at 3 minutes, Ms. Mooney.
Okay, I'll give my concluding statement here then. Thank you so much. This past Friday, one of my clients, who's a 17-year-old transgender honor student in high school, said, "Our lives have become a ballpark for politics." I'm therefore here today as president of TPA and a licensed psychologist who fights every day to help young LGBTQ people stay alive and hold on to hope for a better world and safer environment in which they can live. I look forward to returning in the future to register my wholehearted support for any changes that protect our most vulnerable Texans by enacting language that prohibits discriminatory behaviors against members of the LGBTQ+ or disability communities by licensees of BHEC. Thank you.
Thank you. You're muted, Daryl.
Well, it helps if I can. Ms. Bulls or Buells?
Bulls, thank you. My name is Paula Bulls. I'm a licensed clinical social worker here in Texas. I was actually the person, and I wanted to thank you all for the vote you made this morning. I sincerely appreciate it. I sincerely appreciate the passion that you each bring to these professions. I want to share a little bit about my own passion for this and why I got involved with it. I was the person who back in 2012, when I was at the time on the LGBT committee for NASW Texas, brought forth the argument and presented the case to the board that got gender identity and expression added into the code of conduct. At the time, I had experienced several very personal experiences, both as a transgender woman and as an advocate for that community. Back in 2003, while working on my car, I had sustained a severe cut to my leg, and I went to the local hospital. And I lay on a gurney for 2 hours waiting for someone to come treat me, while listening to people argue outside of the cubicle where I was as to who was going to come in and have to work on me. The following year, and I was left to when they did come in, they did a very perfunctory job of stitching me up, and I have a significant scar on my leg to this date from that. The next year, in 2004, I had a good friend who went to a local hospital with severe abdominal pains. When the doctor realized she was transgender, he told her to get up and leave, that there was nothing that could be done for her. She went to her private physician the following morning, where she was quickly diagnosed as having a ruptured appendix. She went through, I believe, 3 surgeries trying to contain the sepsis before she died at the age of 35. She was a published poet and was a graduate student at Texas State University. Those are the sorts of things that led me to get involved into this. I've got a little bit of just data from the National Transgender Discrimination Survey. This is data specifically to the state of Texas. This is not nationwide. This is in our state. That 79% of the people respondents reported experiencing harassment or mistreatment on the job. 85% of those that were in school reported rates of harassment. 46% in school, this is K through 12, experiencing physical assault. Regarding healthcare discrimination and health outcomes, 16% were refused medical care due to their gender identity and expression, and an alarming 41% reported attempting suicide at some point in their lives, 26 times the rate of the general population. I bring this up specifically because people often think, thank you, I'll try to make the brevity is not my long suit.
And you're at 3 minutes just now, Ms. Bowles.
Thank you. I'll close this up. Social workers work as far more than just psychotherapists as I am. There's caseworkers in shelters, in hospitals, medical social workers. I routinely advise my clients that if they find themselves in a hospital and they think they're being mistreated, to ask for the social worker, the medical social worker on staff who's charged with advocating for them. Our social work definition in the Texas Administrative Code states that one of our roles is advocacy for vulnerable groups, and certainly I've demonstrated that trans people are highly vulnerable. So thank you very much for listening to this, and thank you very much for all of the passion that you all bring to this.
Thank you so much.
Mr. Marsden, did you have public comments you'd like to make?
Yes, and thank you. And I want to reiterate my appreciation for the work that you guys have been doing. We know as professional social workers that you've been charged with a monumental task. And I have been a social worker in North Texas in private practice for over 25 years. In that time, I've supervised numerous interns while they're in graduate school, getting ready to transition to professional roles in our state. I've supervised LCSW interns for over 20 years. We're talking literally dozens and dozens of people. I have never, in my 25 years of doing this, seen so much stress and frustration on the part of our young students and our interns going into greater professional responsibility. I'm here today to speak for them. I have student interns who are getting ready to graduate who've been waiting for months for a response from the board for their applications. I've got kids that have been out of school now for months who are waiting for an opportunity just to take their test, or actually they've taken their test. They're waiting to be processed now as fully licensed social workers. It is unfair to them. It's unfair to the public, and it's unfair to our discipline to have this kind of thing going on. I've got students, or not students, but actual interns who are getting out of their LCSW training with me, who are wanting to take their LCSW exams, unable to move up in the profession. That's unacceptable. I would encourage the board, now that I've reiterated the problem that we're all aware of, I would encourage the board not to overlook out of the box or creative strategies that we may be able to employ to get past this, especially this initial hump that we're trying to get through. I know that myself and many of my constituents would be happy to volunteer time in Austin at the board to help clear out this backlog. But it seems like we're so locked into doing things the way we've always done them that we can't think creatively out of the box. That was just one example of a potential solution. There may be other ones that I'm not aware of. But I think we have to move past the point of this is how we always do it and move into the point of this is what we have to do, because the option of staying where we're at now is just not acceptable. Thank you all very much for your time.
Thank you, Mr. Marsden, and I want to assure you that we have made great strides in that area and will continue to do so, and that we too are looking at novel solutions in order to make that move faster. I appreciate your comments.
Mr. Marsden, I'd also recommend that you reach out to Will Francis and see if he can hook you up, put you on the list of volunteers, because I think he's putting together a list of volunteers for us.
Thank you very much, Daryl. I appreciate that.
Ms. Laura Reed, did you have public comments you'd like to make?
Yes, good morning. Thank you. Presiding member Canseco and members of the council, my name is Laura Reed. I'm a master's in social work student at the University of Houston, which is ranked among the best social work programs in the United States. And I'm speaking for myself today, but I feel my testimony reflects my university's mission and vision to produce leaders who use their education, research, and community engagement to, quote, achieve social, racial, economic, and political justice local to global, unquote. So as an LGBTQ student and future practitioner, I want to thank you for listening to Texas social workers and the communities they serve by recognizing that the council should formally adopt rules that extend protections for LGBTQ+ and disabled Texans across all boards under its authority, including the Board of Social Work Examiners. My classmates and I have been very concerned that the newly revised State Board of Social Work Examiners Code of Conduct would increase barriers for Texans across the state. There are more than 5.5 million LGBTQ people in America, and over 1 million of them live in Texas. And in today's meeting, I have heard council members recognize that the LGBTQ community experiences disproportionately high rates of behavioral health conditions as a direct result of interpersonal, institutional, and structural discrimination. We all know that for many vulnerable populations, the mere threat of removing protections often leads individuals not to seek or engage in healthcare or social service programs. And I can tell you this from personal experience because I was once an LGBTQ undergraduate student seeking mental health services on campus. My university in Texas had limited options. I was assigned to one of only 2 counselors who worked with LGBTQ students. And after returning from winter break for my next appointment, I discovered that my counselor had been pushed out of their job by a homophobic and transphobic work environment. And the counseling center did not notify me until I showed up for my appointment that I would no longer have access to an LGBTQ counselor. And this negative experience has prevented me from seeking mental health services on campus, even when I need them. And so the social work examiner's revised code of conduct would have been more than a threat. It would have allowed social workers to turn away LGBTQ people at a critical point in their care, simply for being who they are. We know LGBTQ and disabled Texans are already at high risk for discrimination outside of social work, and this decision would have increased their barriers to securing affordable health care and mental health services meant to uplift Texans in need. And ultimately, this policy change would have undermined the years of work and trust Texas social workers have strived to achieve in our communities and called into question the integrity of the entire social work profession.
3 minutes.
Okay, I want to conclude by saying that if the ethical implications are not enough for the Texas governor's office, maybe the financial implications will be. Texas taxpayers would feel the financial impact of this decision when patients face denial of care or put off seeking services due to discrimination in an already overburdened healthcare and mental health system. And it cannot be understated that all of this is happening in the midst of a pandemic. And social workers will hold the Texas government accountable at the ballot box. So thank you for taking action today.
Thank you, Ms. Reed. Patrick, when you give us the signal now, would you signal us at 2 minutes and 30 seconds? That way everyone will have an opportunity to speak.
Sure.
Folks, as you're listening, one of us will say 30 seconds, and that means we will cut you off right after that. We need everyone to have an opportunity to speak. Go ahead, Daryl. You're muted.
Ms. Sullivan, do you have public comments you'd like to give?
I do. Thank you for giving me the opportunity to speak. My name is Kimberly Sullivan, and I'm representing my 3-year-old son, James. So as a student at the University of Houston Downtown's BSW program, I can't speak to you as a social worker just yet, but I can speak to you as a mother of a disabled child. A child that Governor Abbott tried to deny protection from discriminatory social workers with his code of conduct changes. When we found out that our son James would need substantial support from his father and I for the rest of his life, we were overwhelmed but determined to be everything he needed. However, the reality that we would not be here for his whole life hit me like a ton of bricks, and I have been breathless ever since. I'm still learning how to move forward with this reality every day. So I ask you to put yourself in my shoes, in every disabled child's parents' shoes, who face the scenario of always leaving behind a physically, mentally, and financially dependent son or daughter, no matter what age they pass, and conduct your actions as leaders in a way that would bring you comfort if this was your reality. My lowest standard for the world whose hands I'll leave my son in is that it is fair. And your previous acceptance of Governor Abbott's code of conduct changes put my lowest standard in jeopardy. So that's why I'm here today. Because if we let social workers, the very people who play a huge part in my son's life, discriminate, who will follow? However, if I can still hope for a world that's better than fair for all, then I easily have every hope in you and your success in doing what is right. I commend your decision on actions that puts you on the path of doing what is right. I urge you to keep on this path no matter what obstacles you face. My son does this every day. We're rooting for you.
Thank you, Ms. Sullivan. Thank you.
Ms. Castle, did you have public comments you'd like to give?
Yes, I do. Good afternoon, board. Thank you. Good afternoon, board. My name is Mary Elizabeth Castle, and I'm the policy advisor for Texas Values, an organization in Texas that stands for Faith, Family, and Freedom. I would like to plead with the board to reconsider the actions that they have taken today and go back to the original decision made on October 12th to clarify policies on the code of conduct so that it is consistent with state and federal law. These types of changes are necessary for agencies to be correct and precise so that they can avoid legal trouble down the road and acting as an unelected legislature. You may have heard testimony from many groups today and hear from many more that the term sexual orientation, gender identity, or gender expression should be added back to the code of conduct, non-discrimination clause, but you should not do that for the following reasons. The terms sexual orientation and gender identity are nowhere in state law, and there is no federal law requiring special rights or privileges based on these identifiers. State agencies need to be consistent with the state and federal law, or else they run the risk of overstepping their powers as an agency. The sexual orientation and gender identity language most likely should not have been in the code of conduct, since that was outside the bounds of what the agency can do and outside the bounds of law. Lastly, adding the term sexual orientation and gender identity in the non-discrimination clause of the code of conduct puts thousands of counselors and social workers in a tough position. Counselors and social workers enter the profession because they truly care about people and want them to live their best lives. For a majority of counselors, those desires come from their faith. Their faith teaches them to help resolve issues, to help people become the very best that they can be. However, adding sexual orientation and gender identity language would force those counselors to violate their sincerely held religious beliefs. Counselors could be forced to affirm for political gain instead of heal people for spiritual well-being. Social workers would be told to leave their convictions out of their office when these people believe that they should not have to hide their faith at work. This state would discourage many genuine-hearted Christians from entering the profession at all. Instead, the profession will be filled with only one viewpoint, will lack diversity, and will most likely be a politically charged profession and not one for people focused on the profession itself. Summarily, some seek counseling on issues of sexual orientation and gender identity in order to learn what their faith says about these issues, and those individuals would be sorely disenfranchised. Social workers and counselors would never turn away someone because of a characteristic, but they have the opportunity to be certain that the best person to help the individual would be referred to them. Otherwise, changing the rule back would force counselors to give substandard care and not provide the best unique care that individual with religious beliefs has to offer. With that said, I would ask the board to reconsider what they did today. Thank you.
Thank you, Ms. Castle.
Ms. Levinson, did you have public comments you'd like to make?
Yes, I would. Hi, thanks everyone. I so appreciate this opportunity. I am a newly licensed LMSW, and I am the mother of a son with a disability. The reason why I chose to change my career at age 65 was because I came to realize how the social work profession was dedicated to recognizing and honoring the inherent value and dignity of every single human being, a credo that is common to both Judaism, Christianity, and Islam. As the mother of a son who was in special education until 2004, when the TEA mandate of quotas for students in special ed programs led to him literally being kicked out of special ed. I have witnessed firsthand and very painfully how a person's being denied access to the full measure of resources in our society has a huge detrimental effect. I could not begin to work as a social worker if I believed my profession was able to deny anybody the services that they inherently deserve as a human being because of a state mandate. On a different topic, I have just gone through the excruciating process of obtaining my license. I saw a disconnect between the numbers I saw on the screen for the backlog and what I experienced and what I have heard from my colleagues. I have one colleague who's been waiting over a year to receive permission to take her LCSW exam. And yet the chart showed that there's nobody in backlog from prior September 1st for the LCSW upgrade. So there's some disconnect there. My last issue is on the communication with staff when I was trying to find the status of my application to get my license once I had passed the test. And I really never found out my status. I received a very rude reply from someone who said that licensing wasn't even her area and she was going to delete any further emails she got from me. And I really never even found out what my status was until after I called on my state representative.
30 seconds.
I did receive permission. So I would just ask that I understand there's an overload of work, but that courtesy should be a mandate. Thank you.
Thank you. Daryl, if you don't mind, will you look into that one particularly? Because of the complaint about rudeness. Who's next?
Dr. Felderhoff, do you have public comments you'd like to make?
I do. Thank you so much for the opportunity. My name is Brandy Felderhoff. I'm a licensed clinical social worker in the state of Texas. And I first just want to thank the board for not only the opportunity to vote and I guess overturn essentially the vote that was held on October 12th, but also just because I feel like this is the best in the best interest of our profession to overturn that vote. And I hope you hear all the appreciation for this that you've heard in negative press for the last several weeks, as you mentioned earlier, because we do so appreciate the opportunity for this vote and the vote that was taken today. I had a couple of areas that I just hope maybe can be clarified before the meeting closes today. I was really, number one, disheartened that we didn't hear anything from the board following the 10-12 meeting until now. And it was also frustrating to then find out today that Executive Director Spinks didn't send forward those comments to the Texas Register, but that we didn't know that either. And I think some of the negative press that came out could have been avoided if the communication had been clearer about what was happening moving forward. I feel like communication is an area with our board that historically has been very challenging, not only for applicants, for renewals, for people whose information has been lost, but now also in the way these meetings are being conducted and the information that we receive thereafter. You all talked earlier about prioritizing work versus communication. And again, this has been an ongoing issue for a long time. And so while I totally value that we're prioritizing the work, it's also really discouraging for the individual applicants to not hear anything back over and over and over again when we have faced these issues over and over and over again. And so I hope that as we move forward, there is a way where we can address individual concerns and follow up with people while also making sure that the work is being done and applications are being processed. Lastly, with supervision plans, this is the biggest clarification piece I hope we can address. In the 10-12 meeting, it was my understanding leaving that meeting that the process would be the changes to supervision plans would go out for public comment in the Texas Register. They would sit for 30 days. And then it was my understanding from the board's comments that there would be another specially called TSBSWE and BHEC meeting to fully adopt that change. And then we would have the change to supervision plans where we would no longer submit them on the front end. What I heard today, if I understood it correctly, is that now that hasn't been put out in the Texas Register for comment yet, and that may get approved at the next TSBSW meeting, which is on December 4th, and then may have to wait to the BHEC meeting in January, or maybe BHEC board members can be present then. And so I just hope we can have some full clarity for some of those issues to make sure that there is no more confusion going forward and we all understand the process. Thank you again so much for your time.
Thank you, Dr. Felderhoff.
Soledad Garcia Brady, do you have public comments you'd like to make?
Thank you so much, everybody. Thank you, Madam Chair, for everything. Yes, my name is Soledad Garcia Brady. I am a transgender woman, and I'm applying to become a social worker. So I want to thank you for what you did this morning, because that means a lot to me. For the last 2 weeks, I've been suffering because the reason why I want to become a social worker, excuse me, is because I want to be the voice of those who does not have a voice in our society. So taking this action really gives me the strength to continue to fight for those, like in my case, want to have a voice in this society. So I do want to thank you for that. And I want for you to continue to do what is right for everybody, not just for the LGBTQI people, but for all the people. So thank you so much for everything, and I appreciate it. Thanks.
Thank you, Ms. Garcia.
Okay, January Fox, do you have public comments you would like to make?
I do. Thank you very much. My name is January Fox. I am the Director of Policy and Advocacy for Prism Health North Texas. I'm also a proud MSW and member of NASW and a graduate of the University of Houston Graduate College of Social Work. I'd like to thank the Behavioral Health Executive Council for making the right decision today in regards to the proposed discriminatory change in the Social Work Code of Conduct. I believe we should have never gotten to this point in the first place. What I think I've heard throughout this meeting is that there were factors that the general public did not know about that have influenced the original vote. And I think that all we are asking for is transparency. This process has not been and has not felt transparent from the very beginning. We're social workers. We're trained to advocate for our clients, our communities, and ourselves, and we were never going to let a rule change like this stand without making some noise. And the information that we were using is the information that we had from our professional organization, yes, from the news media, but any information that we had is what we are basing our advocacy on. If issues like this come up again, and they will, please involve the social work community. We are equipped to demonstrate why discriminatory practices are never a good idea. For the social workers on the board who originally agreed to move along this change, I would recommend a training, a CEU, targeted around sexual orientation, gender identity and expression, and disabilities. We all love a good CEU in the social work world. I appreciate your time and I appreciate your service, and I look forward to working with you in the future.
Thank you, Ms. Fox.
Ms. Karsagi, do you have public comments you would like to make? Ms. Karsagi?
Can you hear me?
I can. Go
Oh,
ahead.
okay, great. I'm so sorry. Yeah, you guys can hear me, right?
Yes, ma'am.
Okay, perfect. Yes, hi, thank you for allowing me to speak to you today. As you know from the many other times that I've spoken, my name is Lpc Karsagi. I was diagnosed as a child with high-functioning autism, and following a blatantly biased custody evaluation conducted by Dr. Kim Arredondo, who attempted to replace that diagnosis with 4 other baseless and unobjective diagnoses, I was subsequently re-diagnosed by multiple experts in Houston, again with high functioning autism. As you also know, I've been speaking out at TSBEP board meetings and now at BHEC meetings for many months, imploring the members of this council to act in regards to the complaint that I filed almost 1 year ago regarding the multiple ethical violations of Dr. Kim Arredondo. I wish to acknowledge that many, including myself, are aware of the burdens that this council carries. We recognize that it is not easy to be in this position and to have inherited so many formal complaints. We also reaffirm what we have previously stated. A custody evaluator is in a uniquely difficult position, and we are not here today to condemn all custody evaluators. Our concern is clear and simple. When a custody evaluator acts in a manner that is antithetical to the ethical principles purportedly upheld and honored by this council and by TSBEP, then we, the public, expect a swift and decisive response. It took Dr. Kim Arredondo mere seconds to have my breastfeeding baby and my toddler son ripped away from their primary caregiver. Why then does it take years to undo such a callous and unconscionable act when the evidence is so clear in this case? The council has been made aware of my situation, of my children's situation, made aware of the domestic violence and the continued domestic violence by proxy, and most importantly, of the ongoing presence of severe injuries to my 3- and 4-year-old sons, both of whom were also diagnosed with autism by Texas Children's Hospital. As you have all seen from the photos that I have presented to you, these injuries range from burns on the face and body, multiple black eyes on both eyes, and bruises on the face, back, bottoms, and even genitals of my sons. As I speak with you again today, what you may not be aware of is that I have not seen my babies in 142 days. This is the result of a fraudulent custody evaluation. This is the consequence of placing innocent children in the hands of a man who admitted in his own testimony to putting loaded guns to his head and threatening our lives no fewer than 10 to 20 times in the presence of his wife and young children. This is the harm that comes from not holding a licensee accountable for reckless and unethical behavior and for clear bias and inappropriate relationships with judges and attorney. This is a travesty, and this is your obligation to correct. You alone are responsible for disciplinary action against a licensee, and I am calling on each of you to let today be the day that you will not simply just listen to our concerns, but that you will finally do what should have been done more than a year ago. Please hold Dr. Kim Arredondo responsible for her multiple infractions and ethical violations. Send the message to everyone here that this council
30
can be
seconds.
trusted to uphold your mandate, which is protecting the public. We are not going away until you take action. Thank you for your time.
Thank you, Ms. Karsagi.
Ms. Hendricks, did you have public comments you'd like to give?
Yes, thank you. My name is Caroline Hendricks. I'm an LCSWS, and I'm the Director of Social Services at Legacy Community Health in Houston. We are the state's largest federally qualified health center system, serving 190,000 community members and 41 clinics in Houston, Baytown, Beaumont, and Deer Park. We have 48 social workers in our agency. On behalf of Legacy Community Health, I am here today to thank you for listening to the community and recognizing that the council formally adopt rules to extend protections to the LGBTQ plus community and disabled Texans across all of your boards. So in vulnerable populations, the mere threat of removing protections often leads to individuals choosing not to initiate or engage in their healthcare or social service programs. So I appreciate today for your swift action today. Thank you.
Thank you, Ms. Hendricks.
Ms. Hudson, did you have public comments you'd like to give?
Yes, I do. Thank you. Can you all hear me okay?
Yes, ma'am.
Okay. So good afternoon. My name is Brittany Hudson. My pronouns are she, her, and hers. I'm the Director of Communications for Lpc Associates of Texas, which is formerly the Texas Lpc Intern Association. Lpc Associates of Texas is a grassroots statewide organization with nearly 3,000 current and future Lpc intern members. First, we would like to thank you for your time and attention to the licensing backlogs, your approval of the Lpc intern to Lpc associate title change that we and other statewide counseling organizations like TCA began advocating for years ago, and your willingness to restore the much needed and ethically aligned anti-discrimination protections for LGBTQIA+ individuals and individuals with disabilities in the Social Work Code of Conduct. As an Lpc intern, I also appreciate your readily apparent concern for future Lpc interns or soon to be Lpc associates. I did want to bring something to your attention though. Earlier today, Mr. Spinks shared a spreadsheet that indicated there are 0 Lpc intern applications pending processing that were submitted before the database transition on September 1st. With the exception of deficiencies. However, we do have dozens of members who applied before September 1st, some as far back as March and April 2020, that are still waiting for their license decision. Further, although we do appreciate you dedicating staff for responding to license concerns 1 day per week, many applicants waiting 4 to 6 months for their license have yet to receive responses from the licensing unit. So my questions for your consideration are: 1, how will the council efficiently and effectively address the concerns of those applicants who have been waiting for several months? Additionally, I'm wondering if you can share the timelines for resolving deficiencies and your strategic plan to assist individuals who have been waiting as long as 6 months without correspondence. Lastly, just understanding that you have inherited many of these issues and are working diligently to resolve them, we would like to thank you again for your time, energy, and attention.
Thank you, Ms. Hudson. And Daryl, we do have that as a regular item on our agenda, so we can address that next meeting. Okay.
Ms. Finch, did you have public comments you'd like to give?
Yes, I would. Hi, this is Dr. Jan Finch. I have been an LCSW supervisor for over 20 years, a long time. I've been licensed in the state of Texas as soon as the licensing appeared. I am also in private practice. I'm adjunct professor at UT Arlington School of Social Work. I'm chair of Comanche Peak Coalition for Mental Health in Hood and Somerville counties. I'm very, very active social worker, as you can tell. I do provide supervision for approximately 30 LMSWs who are seeking their LCSW. I am very experienced in this, and I would like to give 3 simple suggestions. One is to involve experienced LCSW supervisors more in the process. I do not sign anything, any form, unless I am absolutely sure that my supervisee has met all the requirements. If you could make to unload your backload a little bit, if you could make the LCSW supervisor being able to approve the LCSW supervision plans for the past year and a half, that would take a huge backload off of you. I'm just making these suggestions based on my experience. I've worked for the state of Texas for I don't know how many years, so it's been a long time. That's my first suggestion. Make that retroactive so we can pick up that backload. The second one is to put on the BHEC website that you are no longer sending out the renewal pieces of paper, the certificates, because employers often check those things. And mine says that my license expires at the September 2021. So I think that there needs to be a notice on your website about that. And my third recommendation is to automate the system. If you automate the system, you are going to save so much time. I have supervisees putting together these portfolios of paperwork that have to be scanned in. There's no reason for that. It could be all done in an automatic system on the web. So I am really advocating for those things. I have a huge investment in the profession. Social workers are the major mental health providers in our nation, and I support people getting their LCSWs. That's all that I have. Thank you so much for all that you do. And everybody here should receive a Zoom award from me, because being on Zoom for long periods of time is so tiring. I know that. So thank you for all that you do. I appreciate it.
Thank you, Dr. Finch.
Shelley Skeen. Ms. Skeen, did you have public comments you'd like to make?
Yes, I would. Can you hear me?
Yes, ma'am.
Yeah.
Okay, my name is Shelley Skeen, and I'm a senior attorney with Lambda Legal Education and Defense Fund. And we work for full and lived equality for LGBT folks and those who are living with HIV. And the reason that I also, let me tell y'all, I'm an adjunct professor, and I have an LLM in constitutional law and also in LGBT law. The reason that I'm on this call is I don't have a prepared statement, and I don't want to go into legal basis, but I have looked at the code, and the code says that social work practice very clearly includes advocating for vulnerable groups. Those vulnerable groups include the LGBTQ community and those living with HIV and those at the intersections who have disabilities. And so, for example, in our state, we have nearly 1 million LGBT people. That's about 4.1% of our population. And 26% of them do not have health insurance. 27% of them are food insecure. 26% of them make less than $24,000 a year. When you look at our trans population, there are about 125,000 people. 34% of them live in poverty. 17% don't have a job, and these are pre-COVID numbers. LGBT people of color, 39% of them live below the poverty line in our state. So I urge you to keep the protections in place and not to change the language in spite of the AG's opinion, whatever it may be. And the reason for that is because you erase LGBTQ people and those with disabilities. Social workers have the duty to advocate for vulnerable groups. We are vulnerable groups, and we are at the intersections. For example, LGBT seniors, 41% of them suffer from a disability. They are 3 times more likely over the age of 55 to suffer from a mental health condition. We need these protections in place. We're not asking for these because we want special protections. We're asking for these so that we can be held at the same standard as everyone else, and so that we can be seen and named. If we are not seen and named, we're not heard and we're erased. Thank you very much.
Thank you. Thank you, Ms. King.
Mr. Craig, did you have public comments you'd like to make?
Yes, thank you so much, and I appreciate the report allowing the public to be able to speak on different topics here. The topic that I'd like to talk to you about, actually, I do have some questions for the board. I was wondering if one of you might be able to help clarify a few things. Do you have a written response standard on the time frame for handling and responding to complaints filed against psychologists?
Mr. Craig, this is a time for public comment. It's not a time really for back and forth like a town hall type event. You can just give public comment, and the council doesn't necessarily, typically they cannot respond to you.
I did not realize that. Okay. Well, the reason I'm asking that question and some others as well in regards to response time is that back in August 19th, 2019, I know that Wanda Patrick had filed a complaint against Dr. Kim Arredondo for a very poorly written and in many cases falsified report that's been used in court that's allowed a sexual predator to continue taking care of her son and also physically abusing her son, just like what's happened with Lpc Karsagi. It's the same exact psychologist, Dr. Kim Arredondo. And since that report was, the complaint was filed back in August 19, 2019, there has been no communication between the board or anyone from the board or anyone from the investigative body that the board authorizes to look into these different complaints with Ms. Patrick. And my question to the board is, why has that been since August 19, 2019, zero response back by email, phone, text? That would indicate to most board agencies that there was a true ongoing investigation into something that is really, truly horrific. That's just a concern not only for myself personally, but it should be a concern for the board as well as the public, because the board is as respectful as I am of what you do, and I do thank you for your listening to what I'm saying here, has a responsibility to really look into this. And if there's not been any communication as to with the complainant, I don't know if they've contacted Dr. Kim Arredondo, but there's no communication with the complainant that indicates to most people that nothing really has been done. And my concern is what really is truly happening with these investigations. I really would like to know, and I know the rest of the public would like to know that as well too. So that was the reason for my question about the response standards times. If you don't have any in place, then this is the time to maybe consider putting those into writing. If you do have them in writing, then why has it been since August 19th, since report's been filed, that
30 seconds.
thank you, that there's not been any response. So that's my concern and question that I'd like to raise to the board and bring that to your attention. And I do thank you for your ability and willingness to listen. Thank you and have a great day.
Thank you, Mr. Craig.
Elias Cantu, do you have public comments you would like to make?
Hello, my name is Elias Cantu, and I serve as the Texas LULAC Chair of LGBTQ. LULAC is the League of United Latin American Citizens. I represent the LGBTQ LULAC councils across Texas in areas such as the Rio Grande Valley, Corpus Christi, San Antonio, Laredo, and Dallas. We ask that you reverse the changes that are being proposed to the Texas State Board of Social Worker Examiners Code of Conduct, which says a social worker shall not refuse to perform any act or service for which the person is licensed solely on the basis of a client's age, gender, sex, race, color, religion, national origin, disability, sexual orientation, gender identity and expression, or political affiliation. removing these protections based on a person's gender, disability, sexual orientation, gender identity, and expression would discriminate against our LGBT community and persons with disability. Furthermore, today we heard, and you also received a letter from the Texas House LGBT Caucus with signatures from 32 state representatives urging you to reverse this rule, change, and reinstate the former Texas Social Workers Code of Conduct. Each one of the state representatives signed the letters because they represent their constituents in their respective districts throughout Texas, and these constituents oppose the proposed changes. You also received letters from social workers from across the state of Texas who oppose these changes because it goes against the National Social Worker Code of Ethics as well as the Texas Administrative Code. Again, LULAC is opposed to the changes to the Texas Social Workers Code of Conduct because they are discriminatory and would negatively affect an already vulnerable population, our LGBT community, and persons with disability. I do realize that the decisions that were made today address my concerns and requests to this council. We thank you for making the right decision today to protect our LGBTQ community and persons with disabilities across Texas as COVID-19 pandemic. Thank you from Texas LULAC and all of our Rainbow Councils. Thank you.
Thank you, Mr. Cantu.
Ms. Odom, did you have public comments you'd like to make?
Yes, thank you. My name is Gina Odom, and I am calling on behalf of Alyssa Karsagi. I kind of want to echo the comments that she made regarding Dr. Kim Arredondo. It chills me to the bone that someone in the position of her has this much power in affecting the lives and fate of children. And Dr. Arredondo did not. I personally spoke with her as a witness to Alyssa's character, and she completely misconstrued everything that I'd said, left out a lot of facts about the case. It's scary to me that someone like her that does a pretty careless and not thorough job at all is allowed to make a decision that affects children and puts them in the hands of an abuser and away from their mother. One of them was still breastfeeding. It's awful. So I just want to echo what the other gentleman said too about maybe there should be a time limit where you can respond to complaints against someone like this, because these children's lives are being affected every minute they're with them. So thank you.
Thank you, Ms. Odom.
Ms. Biggins, did you have public comments you'd like to give? Ms. Biggins, are you there? Okay, going once, going twice.
As we wait for her, folks, if you need to step away for a break, please do so. We can step out and step back in so that we can try to do our best to get through all the public comments. It's 2:40 right now.
We just need to make sure we've got 5 in the room at all times.
Okay. Thank you. Thanks for that, Tara.
Okay. Ms. Osborne, did you have public comments you would like to make?
Yes, I am here. My name is Kate Osborne. I am a licensed professional engineer, so I am somewhat familiar with at least one licensing process in Texas. And you've heard multiple complaints or comments on previous filed complaints on Kim Arredondo today. And you've heard a lot of talk about discrimination and how your code of ethics prohibits discrimination. Kim Arredondo has discriminated against Alyssa Karsagi on a basis of her religion and on a basis of her neuroatypicalness. I won't call it a disability because I don't believe autism is a disability in all cases. I don't understand why this woman is allowed to continue practicing with a license when she is causing demonstrable harm in not just to one case. I'd really like y'all to consider acting on the complaints that you've heard regarding this woman and remove her from practice, as she's a demonstrated danger to the public safety and health. Thank you for your time today.
Thank you, Ms. Osborne.
Ms. Arlette, did you have public comments you'd like to make?
I sure do. Can you guys hear me?
Yes, ma'am.
My name is Hannah Arlette, and I'm a licensed social worker, but more importantly, a concerned member of the public who has been following the Korsagi case, particularly the aspect involving a clearly biased evaluation by Dr. Arredondo. My subjective opinion of Dr. Arredondo does not carry much weight, given you do not know me. However, you have available to you audio recordings and photographs that indicate severe ongoing abuse of two very young children. The children I am referring to are Eitan and Ariel. They have names. They are real little boys being lost in this battle. These children, and likely others, are actively being hurt as the people who have been given the authority to protect them have stood idle. They do not have a voice. They are not given choices. There is no way to sugarcoat the fact that we as a society have failed Eitan and Ariel and continue to do so. The first time I spoke to this committee was August 28th. It's been 59 days since many others and myself have expressed sincere concern warranting immediate action. 59 days that Eitan and Ariel have been subjected to abuse because no person or agency has taken the responsibility and initiative to ensure that they are in a home that we would want for our own children. 59 additional days that Alyssa Korsagi has lived with the knowledge that her babies are hurting and there is absolutely nothing being done on their behalf. 59 days added to the many months that Eitan and Ariel have not been able to see their mother, hug their mother, or even knowing if their mother still exists. Almost as importantly, it's been 59 more days that Dr. Arredondo has kept in a position that allows her to continue using her own personal bias to justify putting our children in harm's way. When you go to bed tonight, you'll likely be like me, may lay there and worry about finances, making mental lists of things to remember tomorrow, perhaps anxiety about an upcoming meeting. Let us be grateful that we are not Miss Korsagi, unable to sleep because we have legitimate reasons to fear the worst has happened to our children. Let's pray that our children will never know the fear and insecurity that Eitan and Ariel have been experiencing for so long. One item that you can be thankful for that Miss Korsagi nor myself have the luxury of having is to know that you have the power to make things right for Eitan and Ariel and many other children and parents who feel hopeless. My final question to this council is this: will you now take action or wait another 59 days, 100 days, 365 days or beyond? Thank you for your time and consideration.
Thank you, Ms. Arlette. I normally would not respond. We'd have heard this, and your argument was very compelling. I'm not sure what our role is, but I am certain this sounds like a call to CPS should be made. Perhaps I'm speaking out of turn. And for that, to the rest of you, I apologize.
Ms. Alvarado, did you have public comments you would like to make?
Hello.
Hello.
Hi, can you hear me?
Yes, ma'am.
Okay, thank you. Good. I started at 9 in the morning, just like all of you. And so I teach at 3 o'clock. So I was hoping I would get my turn before my class starts. I'm a faculty member at Austin Community College, and I am representing myself. And yes, and so I had something written, but and then I read the 307 document with the agenda and all the letters you've received. And I know you received many phone calls and postcards. And so I don't want to, repeat a lot of what you've already heard. So I want to speak to you from my heart. I am not a licensed social worker, and when I sat and saw the meeting on October the 12th, I made it an assignment for my students to watch, to give them an inside look on this board and what to expect if they go down that route. My stomach was hurting, my head was hurting, and just watching you sit there and approve and with very little awareness, with very little connection, what, and and maybe I'm biased, and with all due respect, I listened to the woman who was all in tears crying about figuring out what to do, a year, December 19th of 2019. And you get people right now offering to help you. And I think that's what's happened. I see that you don't want to look outside of the box. So I'm speaking to you from my heart. Please ask for help. That's one of the things we do as social workers. We tell our clients to not be scared to ask for help. And what I see and what I see a mess. I see individuals who are not listening to what's happening to people's real lives. And with all due respect, Mr. Brown, you talk about having respect for colleagues. If you, the board, were doing your job better, you would have respect for those colleagues that are not your colleagues right now because they're in limbo. So please make them your colleagues. Speed it up. Ask for help. People are calling in saying they're willing to volunteer. They're not even asking to get paid. Do it. Jump on it. Say yes. Help. There are people waiting in limbo. Please do it for them. But get people processed.
30 seconds.
30
Thank
seconds.
you. I just, and I speak to you with love and with respect. And I know you're doing what you can, but please ask for help if to move things along. Thank you very much.
Thank you.
Ms. Kerbo, do you have public comments you'd like to make?
Yes, I do. My name is Brenna Kerbo. I am a final semester Bachelor of Social Work student at Stephen F. Austin State University, and I am speaking for myself as an individual and a proud Texan. I have revised this statement. However, I still want to share my testimony, and hopefully it will assure you that you've made the right choice today. However, we know that the fight for equality doesn't end with today's decision. As a student of social work due to graduate in less than 2 months' time, I was absolutely appalled by the proposed changes to our code of conduct. This code of conduct has included non-discrimination of LGBTQ+ persons specifically for more than 10 years. And no, the word sex does not cover enough without clarification because sex has never been interpreted as LGBTQ+ individuals. In 2018, my beautiful wife, Michelle, and I were refused the use of a wedding video based on legal discrimination. Following that, we were refused premarital counseling from a group of licensed counselors and LCSWs in Nacogdoches, Texas. Being from Houston myself, I was astounded at the difference in treatment I would receive based on rurality. They attempted to shame us then, and I am shocked that people of a quote, helping profession, end quote, would turn away anyone seeking mental health services. We do not need to remove protections from any clause, but expand upon these clauses to align with today's social mores. Anyone should be able to seek mental health services from a professional who has dedicated themselves to a profession which is supposed to be focused on the dignity and worth of all people. I appreciate you all for reversing your vote and for listening to my testimony today. Thank you.
Thank you, Ms. Kerbo.
Ms. Patrick, did you have public comments you'd like to make? Ms. Patrick?
Hello? Yes. Can you hear me?
Ma'am, go ahead.
Okay, we have two that would like to speak here today, myself and my son, Shane. And in the spirit and respect of his disability, he has asked me to ask him questions kind of in an interview form so he can form his thoughts more accurately. Is that okay with you?
Yes, as long as you stay within the 3-minute rule. Yes.
Yes, ma'am. So another question. I do appreciate your time and efforts. Can I just make my statement and then go into his questions as part of that total 6 minutes so he can have the flow that he needs to express his thoughts?
I think that's fine since you're 2 people.
Thank you very much. We appreciate that so much. So on my formal complaint to you guys about Dr. Kim Arredondo, my name is Wanda Patrick. And I do thank you guys for making our accommodations, allowing the public to speak. I believe it's Ms. Canseco that mentioned CPS. Please understand, in my case and the Karsagi case, we have not just us, doctors, therapists, nutritionists, general public, teachers have called CPS too many times to count. And due to Dr. Kim Arredondo's connections in the family court system, and I hear at the governor's office, I have no proof of that one, but her connection with our family court judges in Brazos County, people are getting fired. Not only are these reports being ignored, but there are also I've got a doctor and a nutritionist that have been fired from their jobs because they would not back off of their report. So people have reported this multiple times for both of our situations. It is a well-known fact that formal complaints have been filed against Dr. Kim Arredondo. Each complaint, for some reason, has been dismissed. Instead of restating things that have been said here today and in the past, I'll point out a couple of different things. Dr. Kim Arredondo is not only misdiagnosed Alyssa Karsagi, stating that she does not have, nor has ever had autism, but she's misdiagnosed my son Shane with autism. In his 19 years, he has never been diagnosed with autism. One test came out on the spectrum, but all of the rest has said that he shows no signs of autism. I just would like to know how many other people that she has diagnosed over the years. Is it just because she's incompetent, or is it something more nefarious? Is she deliberately misdiagnosing people? Is she just incompetent, or is she deliberately misrepresenting the facts in her social studies? She has in the Karsagi case, she has in mine, she has in multiple other cases that I've actually seen the concrete evidence in. My complaint has over 800 pages in it, along with concrete evidence. So due to what I see as encouragement by Dr. Kim Arredondo's behavior, my son Shane has been recently sexually exploited. He's about to explain how he was made more vulnerable to such exploitation by some of the things that Dr. Arredondo told him when he tried to report things to her. So Shane, how are you doing today?
I'm doing good.
Would you tell everyone hi?
Hi.
I have some questions to ask you. Is that okay?
Sure.
Do you know Dr. Kim Arredondo?
Yes.
How do you know her?
He's my grandma's friend.
She's your grandma's friend. Okay. Another thing, she happens to be his grandmother's friend. My ex-husband's friend was allowed to do our social study. Massive conflict of interest. Tell us what happened with you and Dr. Kim Arredondo in court.
Oh, okay. So I'll tell you the proof. So when I was at the court, Kim grabbed my shoulder hard, shake me a lot, and then she was poking me, and then she would tell me to. I said, "Ouch, that really hurts," and I said, "I will get you, Kim Arredondo."
Okay, so did you ever tell Dr. Kim Arredondo about your dad having sex in front of you?
Yes, it's true. Dad was having sex with a girl named Tammy. So Dad and Tammy, it was back in Burleson, Texas, when I was sleeping in their bed, I first woke up and then I saw those two were having sex, and then Dad was squishing Tammy, and then it was so inappropriate. I saw Dad was squishing. Okay, get ready, all right? Dad was squishing, and then Tammy says, "Oh yeah, oh yeah," and then it was squishing.
Okay, I think we
back
get
and
the
forth.
idea, babe. I
Yeah.
think we do.
Yeah.
So when you told Dr. Kim about this, what did she say?
She says.
Did she have a problem with it? Did she say it was okay? What did she say?
She says it was okay.
So she said it was okay
Yes.
for your dad and Tammy to have sex with you in the bed with them.
Yes.
Okay.
In front of me.
In front of you.
Yes.
Okay. So, how did that make you feel?
Unhappy, uncomfortable.
I agree. That would make me uncomfortable too. So tell us about Dr. Kim calling your dad to her office.
Oh, we had to go to her office because they had to put Kim has to put Effie's number on my dad's number, so that way Glenn and Effie can connect each other to talk to each other.
So who is Effie? What's his last name?
Effie Kursagi.
So that's Alyssa Korsagi's ex-husband.
Yes. It's
That
true.
Dr. Kim Arredondo put
30
his number
seconds.
on your dad's phone.
Right.
Okay. So what would you like to see happen with Dr. Kim Arredondo?
I will help them with Kim's hearing.
Okay, but they're fixing to wrap up. What would you like to see happen to Dr. Kim Arredondo because of the way she behaves?
Oh, Dad and Glenn.
Well, he's trying to tell you that, tell her to go ahead and say it.
Dad will help Kim with her hearing in the court.
Yeah. So basically, she connected Effie Kursagi with my ex-husband, both known abusers, so they can help
Thank you.
testify in front of you guys.
Thank you, Ms.
and
Patrick. Your time is
yes.
up.
Okay,
Appreciate
well, thank you very much.
Appreciate it.
Ms. Basiri, do you have public comments you'd like to make? Michelle Vasiri, do you have public comment? Okay, going once, going twice. Ms. Fitzpatrick, do you have public comments you would like to make?
Yes, thank you. Good afternoon. My name is Kate Fitzpatrick. I'm the MSW Student Board Representative for NASW Texas and a Master of Science in Social Work candidate at the Steve Hicks School of Social Work at UT Austin. I'm also in their Bridge Scholars program studying transition skills for post-secondary youth with autism spectrum disorder. But I'm also speaking to you as the mother and stepmother of 3 teenagers with neurodevelopmental disabilities. I'd like to thank the Texas State Board of Social Work Examiners and the Behavioral Health Executive Council for deciding to retain the language that specifically forbids discrimination against persons based on disability, sexual orientation, and gender identity in the Code of Conduct. About 15% of children in the US will be diagnosed with neurodevelopmental disability before age 18, and about a third of those will be diagnosed with more than one. About 35% of people diagnosed with a neurodevelopmental disability also experience lifelong mental health challenges, including depression and anxiety disorders. People with neurodevelopmental disabilities have an unemployment rate that is much higher than that of their non-disabled peers, often due to the invisible but devastatingly real social emotional challenges related to their disability. Recent studies have shown that people with neurodevelopmental disabilities are also significantly more likely to identify as transgender or non-binary and have a lesbian, gay, bisexual, queer, or asexual sexual orientation. Removal of these explicit protections would place this population at increased risk of discrimination on multiple levels, from the very professionals that are trained to provide them with the social, emotional, behavioral, and community level supports they may need throughout their lives. As a scholar and aspiring social worker in the disability community, the possibility that a social worker could behave unethically due to the mistaken belief that they are allowed to discriminate against these populations, or that someone with a disability might avoid seeking help due to concerns around being discriminated against, has been worrisome and frustrating. But as a parent, it is downright terrifying. For these reasons, I am requesting that the Behavioral Health Executive Council and the Texas State Board of Social Work Examiners strongly advocate that the Attorney General allow the board to determine the standards in the Code of Conduct and retain the anti-discrimination protections in the Code of Conduct for social workers in Texas. Thank you.
Thank you, Ms. Fitzpatrick.
Shayna Balkin, do you have public comments you'd like to give?
Yes, I do. Do you guys hear me okay?
Yes, ma'am. Go ahead.
All righty. Thank you so much for the opportunity to speak here today. Work as a book editor, but most importantly, I'm a mother of 3 children. And today I'm here speaking on behalf of Alyssa Karsagi, who, as you know, has had her 2 precious children unjustly taken from her and put into the care of a known abuser. Countless people who I know personally would tell you firsthand how Alyssa's shown incredible care and love for their own children. She has watched my own children for me, and I put full trust in her. Many, many people I know have entrusted their children to her and continue to do so on a regular, even daily basis. Alyssa is an obviously loving mother, capable of giving the world to her children, yet due to injustice and corruption in the system, particularly on the part of Dr. Kim Arredondo, Alyssa's children have been without the critical love and care of their own mother. It's extremely damaging for a child to be taken from a loving parent, especially for months on end with no end in sight. I'm extremely cautious with who I entrust my own children to, yet when I met Alyssa, saw how loving, gentle, and natural she was with my children, coupled with the positively raving references from so many friends, it was a no-brainer to trust her with my own children. It's also a no-brainer to entrust Alyssa with her own children. To you who are listening, I implore you to immediately take steps necessary to reunite Alyssa with her children who desperately need her. I also implore you to investigate those who put Alyssa and her children into this situation in the first place. Anyone reviewing the details of this case will see clearly and overtly that this should never have happened. And even should Alyssa and her children be reunited today, the damage already done may be irreparable. We like to believe that anyone in the position to judge these families always has the best intentions at heart, but we all know that's not always the case. Corruption does exist. Bad people in positions of power do exist. We all hear sad stories all the time about families going through this or that. It becomes easy to disregard or tune out these stories as they all blend together. But each of these stories is about real people. Alyssa is a real person. Her children are real people. They're going through real trauma and injustice right now, and you can help them in a real way. You know, sometimes we don't know what we can do to help, but Alyssa and others have been begging for help from every single possible direction, and everyone tells her there's nothing they can do. It cannot be that nobody is in a position to help. If you're not in a position to help, please find a way to put yourself in the position to help. There's
30
something
seconds.
each of us can do, and we owe it to Alyssa's children to do our part to remove these children from harm's way. If it were your sons, your daughters being beaten, would you say there's nothing you can do? If it were your sons, your daughters being burned on their faces, would it be nothing that you could do? Maybe it might take some extra thought or creativity, but there's something everyone can do. Please hold Dr. Kim Arredondo accountable for what she's done to this family, and please don't
Thank
let
you,
this injustice go on. Thank you very much.
Alyssa Shiguru?
Shiguru, yes.
Shiguru, I'm sorry. Yeah. If you have public comment.
Yes. All right, thank you. Good afternoon, everyone. Thank you all. I'm Alyssa Shiguru, a licensed social worker, a member of the LGBTQ community, and a policy coordinator for NAMI Texas, the Texas chapter of the National Alliance on Mental Illness, the nation's largest grassroots mental health organization focused on improving the quality of life for individuals living with mental illness and their families. So I'm here to show appreciation for the BHEC for reinstating protections for LGBTQ individuals and individuals living with disabilities in the Social Work Code of Conduct. We at NAMI believe everyone has a right to access mental health services and supports. We know that individuals with disabilities and LGBTQ people have higher rates of mental health issues, and that mental illness often falls into the category of disability. So just kind of addressing some of the concerns we had kind of prior to the reinstatement, we're concerned any rollback of anti-discrimination protections reflect a broader trend in state policy. So in 2019, Senate Bill 17 prohibited licensing penalties for health providers, including mental health providers who deny services to individuals if denial was based on their sincerely held religious beliefs and didn't violate federal law. So while this bill didn't pass, the governor's recommendations to remove those protections in the Code of Conduct for social workers would have a similar impact to what that bill was going for. But one that did pass in 2017, House Bill 3859, did the same thing for child welfare providers. And after that session, DFPS quietly removed from the Foster Care Bill of Rights the right for children to receive fair treatment, whatever their gender, gender identity, race, ethnicity, religion, national origin, disability, medical problems, or sexual orientation. So the current version of the Bill of Rights mentions be treated fairly and have my religious needs met, but includes no other similar language. The reason given was it was to align with another legal document. So I understand there are technical reasons they're being given by the governor's office, but their recommendations tend to follow a trend that is, moving away from having anti-discrimination protections for a number of populations. My second point on here, just individuals with disabilities and LGBTQ people face disproportionate mental health outcomes. LGBT adults in Texas were 4 to 5 times more likely than straight adults.
30 seconds.
30 seconds.
In past year, similar rates of high school students actually attempted. Adults with disabilities are 2.5 to 5 times more likely to have considered in the past year than adults without. And there's strong intersections between these two populations, as someone mentioned. So we're concerned that
Thank you, Ms. Sugar. I think
we just want to make sure it stays in. Thank you so much.
Thank you.
Ms. Lackey, did you have public comments you'd like to make?
Yes, can you hear me?
Yes,
ma'am.
All right, thank you so much. My name is Sarah Lackey. I'm a licensed master social worker. I work with older adults and people with disabilities in the Austin area. I would like to thank the council for your vote to restore protections for LGBTQ and disabled clients. Thank you for listening to the concerns of social workers and the general public and doing right by Texans by taking a stand against discrimination. My request is that you continue to be on guard and thoughtful about recommendations from the governor. I understand that the governor's office cited the Texas Occupations Code and stated that our code should not go above the protections listed in that law. Our professional code of conduct does not violate the existing statute, but merely expands upon it. However, his office already knows that, and I reject their explanation. The governor has actively worked to discriminate against the LGBTQ community. Some examples include his condemnation of the Supreme Court ruling, which legalized same-sex marriage, his attempt to revive the bathroom bill to legislate how transgender people use public restrooms, and the 2017 legislation to allow adoption agencies to refuse same-sex families from adopting children. The Attorney General has a similar record. Please continue to use your position on the council to serve current and future social work clients, licensed social workers, and the principles that we stand for, which are outlined in our code of ethics: service, dignity and worth of the person, importance of human relationships, integrity, competence, and last but not least, social justice. As a standard for cultural competence, social workers are to participate in the development and implementation of policies and practices that empower and advocate for marginalized and oppressed populations. I ask you to work with us on this advocacy mission. I fully recognize this puts you in a difficult position with government officials. I recognize that, as Senator Menendez stated, leadership can often be a lonely place. Please know that if you stand by Texas social workers, we will stand by you. I thank you for your time and your service.
Thank you, Ms. Lackey.
Ms. Villegas, do you have public comments you'd like to give?
Yes, I do. Can you all hear me?
Yes, ma'am.
Yeah.
Go ahead.
Okay, my name is Kayla Villegas. I'm a BSW here in El Paso, Texas. I not only represent the profession, but I also represent the disabled community. It was because of social workers in my past that led me to want to pursue this profession. I'd like to thank you all of the board for your vote on making the change correct. As social workers, we do like to make sure that our clients feel represented and protected in every way. As an individual with a disability, it was social workers that did make me feel like I had a voice and I had a purpose. Unfortunately, many of us with disabilities, we do not have the option or control of our disabilities. Many of us are often born with it, so it is out of our control. But you as a board do have control. You as a board do have the voice and the power to make change and the power to allow each individual in not only our state, but in the world to make sure that we are represented and we all have a voice and make sure that we all feel we have a purpose on this world, on this planet. I'd like to thank you again very much for all the efforts you put in. And I'd also like to thank every individual that joined us in this fight, because without you, it shows very big that our voices are very powerful when they're held together. Again, I thank you very much. On other issues I'd like to address, part of the licensing process. Many of us have included the request for temporary license during our process of preparing for our exam. Due to the pandemic, it has been issued quite well. We have been
30
seconds. 30
Yes.
seconds, sorry.
We have been put with a delay with being able to hold our temporary license longer than 6 months. Due to the pandemic, it did put issues on test sites because we weren't fully aware of how test sites were functioning. I do like to ask the board to take into consideration to reevaluate the options temporary license holders have. Perhaps those who purchase can be extended till they take their exam the first time.
Vegas, you're out of time, but thank you so much for your comments.
Thank you.
Ms. Callahan, did you have public comments you'd like to give? Mary Beth Callahan, do you have public comments you'd like to give?
Oh, yes. Hello. This is Mary Beth Callahan. I'm a licensed social worker in Dallas area. I appreciate today's vote to keep the anti-discrimination protections remaining intact. I am concerned regarding the request for the AG opinion regarding the scope and standards of professional social workers. To open any cracks in a set of codes and standards would exacerbate the already existing barriers to the social determinants of health. I've been a medical social worker for 35 years in Texas, and during this time, I've worked on numerous boards, including the Council of Nephrology Social Workers, the Society for Transplant Social Work, the Society for Social Work Leadership in Healthcare, and with the Social Workers in Hospice Palliative Care Network. I hope that Behavioral Health Executive Council's lack of response to the proposal at the 10/12 meeting will never again occur, so to speak, in the dark of night or in any other form. It seems to me that where 3 or 4 professional social workers or more or gather at a board meeting and hear that a proposal to take out anti-discrimination protections are coming for a vote, at least one member of the group would stand up and say, let's discuss this more, let's investigate this, something about this doesn't seem correct. As social work professionals, we must always advocate for the dignity and the protections of the vulnerable people we serve. We must be transparent. It is our duty and our ethical responsibility. Thank you for allowing me to participate today.
Thank you, Ms. Callahan. And to be clear, more than 2 people on this board spoke exactly as you mentioned there. Okay, Mr. Hagler, Yakov Hagler.
Mr. Hagler is using an older version of Zoom. I'll have to promote him to a panelist to allow him to speak. So hold on just one second.
Okay.
Mr. Hagler, you have public comment?
Yes. Hi, my name is Yakov Hagler. I work in construction management and I'm a father. I would like to express my appreciation to each of you for allowing me to speak to you today. I have been made aware of this council as responsible for deciding the outcome of complaints against custody evaluators, including Dr. Kim Arredondo. I'll be honest with you, this case concerns me deeply as a person, as a husband, and most of all, as a parent. I cannot imagine how something like this could happen in America. What is even more horrifying and shocking, however, is that the devastating consequences of the biased report of Dr. Kim Arredondo still to this day have not been addressed. And that is absolutely unacceptable. Given the overwhelming evidence in the Karasagi case and in many others, it is deplorable that it would take this long for an oversight committee to undo the harm that has been caused by an unethical evaluation, especially when children continue to be harmed and abused. I recognize that this council inherited these complaints from the Texas State Board of Examiners of Psychology, and while I am sympathetic with that, I must reiterate to you what others have stated. As of now, this case is with you, and it is within your power to do something to undo this travesty. You are now tasked with taking action against Dr. Kim Arredondo for her unethical and biased report, and we must insist that you do this. Thank you.
Thank you.
Ms. Hackner, did you have public comments you would like to give? Sharon Hackner?
Yes, I do. Can you hear me?
Yes, ma'am. Go ahead.
So I'm speaking today on behalf of Ms. Kasagi. And what concerns me the most about this, I know one of the moderators earlier mentioned it would be helpful to be calling CPS. I'm not sure if the council is aware that on a number of occasions when CPS was reached out to specifically with regards to the abuse occurring to Eitan and Ariel, they were unable to assist. And when they were pushed for a response of why, Alyssa was told that they are not able to do anything because of the initial assessment given by Dr. Kasagi regarding the custody case, and they have to go based on the court-approved assessment, and they were unable to intervene. And this was in spite of several times that Alyssa herself saw during the few visits she was able to coordinate with supervision, which to me is ridiculous that she needs supervision. But this past month, CPS confirmed to her that the reason they're unable to intervene in her case is because there's already a pre-existing assessment that was accepted by the courts, and they have to, go by that. And Alyssa was unable to take photos of the injuries on her children because the supervisor told her that the visit would be terminated if she did so, and that they are not allowed to. And anybody placing regulations like that on a visit, it just seems completely unlawful to me. I don't understand how something like that could occur. And it's just screams corruption in my view. I personally am a special educator. I've been teaching special education for over 10 years, and both in Australia and in New York City and in Texas. And I understand that my personal experience of teaching special ed isn't necessarily relevant from a professional standpoint as acceptance. Like, you can't accept my testimony as evidence that Alyssa definitely presents all of the factors consistent with being on the autistic spectrum disorders. But I can tell you that in my experience as an educator, it's 100% consistent, and I don't understand how somebody could misassess that. And when I think of the children that haven't seen their mother for this long, and every visit that they wish to see their mother, the ending of the visit is so heartbreaking on both sides that they can't be together more. The only people that can undo
Ms.
this
Hackner. I think you're out
is
of
you.
time. Thank you.
Ms. Riley, did you have public comments you'd like to give?
Yes, I do. Thank you for allowing me to speak. Can y'all hear me okay?
Yes.
Great. My name is Jessica Riley. I'm an undergraduate social work student in my senior year at St. Edward's University in Austin. I am an intern at NASW Texas, co-chair of the College Student Commission at the City of Austin, which represents over 100,000 college students within city limits, and a proud member of the LGBTQ+ community. I came here today, like many others, ready to passionately oppose the October 12th Code of Conduct changes and demand that the code be restored to its original form. I'd like to express my considerable gratitude for the unanimous decision this morning to restore these codes. Similar to many of the students at this meeting who've come to have their voices heard, I do not have a specific client base that I'm here to advocate for. I do not come with years of experience as a Texas social worker. I do not speak on behalf of an agency or organization that I've been with for multiple years. I come as a student, recently trained and eager to serve. Every day, I learn more about the professional world of social work, the laws that guide us, and the state codes that hold us accountable. I have learned over the past few weeks that the rights and protection of clients and at-risk populations lie in the balance of government and regulatory bodies. If I someday see a fellow colleague refuse services based on ability or intentionally dead name a client as to delegitimize their gender identity, I want to know with 100% certainty that they will be held accountable for these discriminatory acts. I am here today to thank you for voting to uphold standards for equity and anti-discrimination, but I am also here to ask for transparency moving forward. The process in which the previous changes were adopted is unacceptable. The decision came without warning, without clear opportunity for input from Texas social workers, and without transparency. Any students listening to me speak will understand when I say this. I am not yet licensed in Texas. I have the unique opportunity right now to decide what I want to do, where I want to work, and which state I would like to invest my services in. 2015 census data interpreted by the George Washington University Health Workforce Institute found that in Texas, there is approximately 80 to 157 social workers per 100,000 population, compared to the upwards numbers of 572 social workers per 100,000 in places like District of Columbia. We're already behind. We're already losing passionate social workers every day who see the limited state level support in Texas and go elsewhere to practice. This previous decision alone was enough to convince some to leave, and I've spoken with other queer students who've decided this misstep was enough to seek post-grad employment outside of Texas, and we cannot allow this to happen again. Now that the council has managed to do damage control and reverse this decision.
Thank you, Ms. Riley.
Okay, thank you for giving me this opportunity.
Sure.
Okay, Ms. Biggins, let's try this again.
Yes, thank you for giving me another shot here. I just wanted to say that in watching everything, my heart does go out to those that in this 15-day time frame have been affected by this, for the potential of what it meant. And upon reflection today, what I would hope is for a better understanding or explanation for why it did happen on the 12th. I watched the meeting afterwards and saw how everything was explained and how the votes were made and how no one, this is my recollection, hopefully I'm not recollecting incorrectly, and no one said anything except okay. And there was even a comment made about this code of conduct change was even like given to the AG to look at. So there was some, reflection about this made before it was presented for a vote. And what I remember happening is that Will Francis spoke up and said, hey, this is a no-go. And from his moment of standing up and speaking out, there was the tabling of it and the move that it would, from there, that's where I saw what led to this moment here today. And that is where I sit and kind of scratch my head and would appreciate more insight from where y'all were coming from, because I do not want to make an assumption, but without information, I'm not sure how to interpret what I saw. And along in that same vein, just to further just mention that there was the comment for further changes for the social work where we, as social workers, we don't engage in sexual relationships with clients. And there was language about questioning why that is such and should it be modified so that there leaves a opening for some type of sexual relationship with past clients. And I know that someone spoke up in regards to that and acknowledging that as a social work profession, we have been distinctly different in that area. And I just wanted to make sure that that would also continue to be, if there were going to be any changes to that again, that doesn't happen like this, where no one's made aware and that it's done without thought and consideration to what social work ethics, standards of practice, best practice are that are unique to our profession. Thank you for coming back to me again. I appreciate that.
Thank you, Ms. Biggins. And I think if you refer to the minutes of this meeting that were approved today, you'll get more information and more answers to your questions. Thank you.
Olivia, did you have public comments you'd like to make? Olivia?
No, thank you.
Okay. Ms. Osborne, do you have public comments you'd like to make? Have you already spoken once?
Yes.
I spoke, but I did not use my full 3 minutes. Can I use the remainder of that time now?
No.
No, ma'am.
We're on to Ms. Huber.
All right.
Ms. Huber, do you have public comments you'd like to make?
Yes, and thank you for taking the time to listen to me today. I first visited with y'all on August 28th, 2020. This was 59 days ago, and unfortunately, nothing has changed since then. Alyssa Karsagi has lost both her children and has not been able to hold them, touch them, or see them in over 140 days. Can you imagine not being able to be with your children or grandchildren for that long? Not only not being able to see them, but knowing that they're being abused. After many, many cases of her reporting, not her reporting, but others reporting that these children have been abused and CPS not following through on this, she has been deemed not able to see her children because she she causes too much trouble whenever she does. Her husband has been keeping her children from her. Dr. Arnando has falsely accused her and misdiagnosed her. I have been a family friend of Alyssa's for almost 20 years while working with her in college with many athletes and holding responsibilities that no 18-year-old should be allowed to hold. She not only followed through on these things, but she stepped up and excelled at them. She worked with many athletes, injuries, doctors, and teams to help make sure that they got back to where they needed to be. During this time, she also watched the coach's children, and up until this day still keeps in contact with these kids that now have kids of their own. It's amazing to see Alyssa with kids. I have stayed the night with her when her ex-husband was not there and was out of sight. When both boys were sick, both Ariel and Aton had the stomach bug, and Alyssa had not slept in 3 days. She still kept her calm, took care of these boys, made sure they were fed, washed, and the house was taken care of so that they could get the best care that they needed. This is the type of mother these boys need in their lives and need to be with day and night. For somebody to take these rights away from her is not only cruel, but it is unfair. You've heard from many others with the same situation that Alyssa has watched their children up until this day. Alyssa is an amazing woman, an amazing mother and friend to so many, and it hurts us to see that she cannot be with her children. I urge you to think when you go to bed tonight what it would be like if you not only did not have your children, but if you knew that they were in harm's way by somebody else. What would you do to move mountains to make sure you got them back? Please don't allow her to go another 59 days by not being able to be with them. Thank you for your time today.
Thank you, Ms. Huber.
Okay, Ms. Basiri, let's try this again. Do you have public comments you'd like to make?
Hello, can you hear me?
We can.
Yes. Okay, thank you. My name is Michelle Vetchery, and I am a friend of Alyssa Karsagi. We met about 13 years ago, and I entrusted her with my children. I have 7 children, and she is a wonderful, loving, caring person. I don't entrust my children with just anybody, and I totally trusted her with my children. So when I heard about what was happening with her children and the abuse and the problems that she's having trying to be able to see them, and that they were violently taken away from her while she was still breastfeeding them, it just breaks my heart. And I know she has tried numerous times in numerous ways to get them back. And she sees you all as this kind of a very key element in pleading with you to see that Dr. Kim Arredondo has been misevaluating her every single time, and it's causing her not to get the help that she needs from the judge or CPS, and she's not able to see her children. It is heartbreaking. And then when she has seen them in the past, she has seen that they have bruises and burns and injuries, and it's just unbelievable what this abuser, her husband, is getting away with, who has been known in the past to put a gun to his head and threaten his life and the lives of others. So I plead with you, please review what Kim Arredondo is doing. And for the sake of the children, please take an effort to stand up for them, because they cannot stand up for themselves, and for Alyssa, who also has a disability. So please, I urge you to stand up for her and fight on her behalf. Thank you for letting me speak today.
Chaya, do you have public comments you'd like to make? Chaya?
Hello?
Chaya?
Yeah,
Yes.
hi. Hi, you hear me? Hi.
Yes.
Hi. So yeah, I'm speaking for Alyssa. Alyssa has been actually just met, well, we met like
Could you state
2
your
years
full name
ago.
for us? Ma'am, could you tell us
Yeah,
your full name?
hi. Yeah, my name is Kaya Rosenberger. Got it?
Okay. Yes, ma'am. Go ahead.
Oh, okay. So Alyssa has been part of our family for the past like I think like 6 months. She just did transformation. She you know, I have 3 kids under the age of 8, and my kids had some problems in school with, you know, we took them out of school, and she kind of just took over and just changed our lives and changed our family life. She, you know, she comes over every day and takes care of them. My kids can't get enough of her. Like they need her, you know, she comes over weekends, and every day she, you know, she homeschools them, and just, you know, they weren't into the education because of the trauma they had in school, and she just transformed that all. My 3 kids are, you know, growing so much with her and learning. It's like unbelievable to see how she got them all 3. She does all 3 at once, and she teaches them, you know, be above their level. And she just goes above and beyond to help us out and, you know, keep, you know, my kids, with discipline, and she's just been a really big help to our family. And just so you know, we entrust our kids with her for every single day. And we tried other people. Last year we were homeschooling too, and nothing worked out. We tried a whole year of homeschooling and tried many different kinds of people, and she's the only one that you know that she just transformed our lives and my kids' lives. So yeah, I mean, it's traumatizing to hear all the trauma that she's going through, and I hope she could get back her kids, because she's just an amazing mother, person, and you know, so yeah, thanks for letting me share.
Dr. Beck, did you have public comments you'd like to make?
Yes, I do. Can you hear me?
Yes, ma'am.
My name is Dr. Natalie Beck, and I have been practicing as a licensed professional social worker in Texas for 11 years. Throughout this time, I've worked with numerous clients who've benefited from the protections that were removed, including clients with disabilities, many of which were invisible, and clients from the LGBTQ community, which can also be invisible. When clients trust social workers enough to open up to them about these often invisible and stigmatized identities, in no world or state should we be able to then reject them and turn them away. To further exclude and deny services to vulnerable and oppressed groups of people runs counter to the NASW Code of Ethics. This code is what centers our practice, and it does not change depending on the state that we work or live in. The dignity and worth of each person are central to social work, and therefore discrimination should not be allowed in the Texas Code of Conduct. I love Texas, and I have spent my entire professional career here. Like my amazing student Jess mentioned earlier, I often hear students and colleagues talk about wanting to leave because other states respect and fund social services more. But I tell them that Texas needs their passion and talent and encourage them to think about staying to serve their own communities. Texas also needs to encourage them to stay and serve their communities by providing a code of conduct which matches social work ethics and helping their communities know that their whole selves can be shared with social workers without fear of rejection. Our code of ethics tells us that social workers should not practice, condone, facilitate, or collaborate with any form of discrimination, which is why I'm here today speaking out against this rule change, about this rule change. I appreciate you voting to return the anti-discrimination protections to the code of conduct and restore it to its previous form. Thank you.
Ms. Mills, did you have public comments you'd like to make?
I would. Can you hear me, sir?
Yes, ma'am. Go ahead.
My name is Kathleen Mills. I'm a licensed professional counselor supervisor and a certified employee assistance professional at Lifetree Counseling Center and workshop ethics trainer at practicementors.us. My point I would like to make: 1, given the size of our state, how rampant is the problem of discrimination? Of course, one is too many. We have heard personal case stories today, and I believe every one. But legislating behavior in this manner is unnecessary. Do we need another statute, rule, or something else that applies to a counselor population of which 99.8% of whom are already following existing state law? No one has ever quantified it in terms of numbers. Number 2, this is creating right now a huge divide amongst professionals. Number 3, there are laws on the books. If you don't like them, change them for a better outcome. Today's decision was not to put the clause back because it was never taken out since October 12th. Today, BHEC agreed, let's wait and see what the OOG determines if it conflicts in any way with existing state laws. And if it does, we will deal with it. My heart is saddened to think that a fractional number of counselors are mistreating and discriminating and refusing to provide mental health care. Number 4, let's not forget why BHEC was formed: to clean up the mess that was the previous boards created. My hope is that all members do the proper education to teach each counselor the new relationship that now exists between the state of Texas, BHEC, and each licensing board. It sounds to me like public commenters think they can just work through BHEC in order to change the board rules. And I don't think that is exactly how it is set up. BHEC is not a supplement to each board. Rather, they are the checks and balances so that the uninformed population and special interest groups can't rough ride shot over the board. Number 5, my final point: the reason this conversation is even happening right now is because BHEC is making sure the rules from all of our boards are in sync with state law. Let BHEC do its job and change the state laws at the state level if they're inadequate. Thank you for your time.
Ms. Ridley, did you have public comments you would like to give?
Yes, good afternoon, and thank you for taking my comment. My name is Marissa Ridley. I am an LMSW in the state of Texas. I'm an LCSW in the state of Utah. So I want to break down my dates. I applied for Texas July 1st with my completed faxed, emailed, and actually email or snail mail. I know that the department cashed my check on July 20th. I then decided, because I knew the backlog would be in a long time, I registered and approved and tested in the state of Utah in the 1 month time for Utah in August. So when I passed my exam August 17th with Utah, I submitted my test results to October 6th to the state of Texas. I also emailed on September 2nd to our Texas State Board to request where my status was to make sure I didn't get mixed up in the shuffle. So I want to state that, so you want to know why I'm licensed in Utah? It's because I knew the board would be unable to provide me with a license in a timely manner based off the extreme backlog. I knew that this firsthand with my supervision change of location request took 9 months to be processed. Due to the large delay I experienced, I stopped providing free counseling to my community. That positively impacted my clients and my community members. I was and am unable to continue to practice social work in the clinical setting until I'm licensed as an LCSW in the state of Texas. I want to be providing counseling. I want to be providing the large backlog of mental health assessments needed in my hospital, but I cannot do that until I have an LCSW in this state. So I went a different state to give me that chance to take an exam and license me. So I still need Texas to issue me my LCSW I have worked towards with thousands of hours I provided free to my community, my personal money to support that program. I am here to volunteer to do scans. I reached out to Will Francis. I want to be licensed, and all my fellow social workers deserve to be licensed also. I also want to thank George Francis as an LMFT who spoke up, and I felt represented social workers and were in our corner asking for change and questioning how we have done things and how we can prevent this from happening. That is all. Thank you.
Ms. Panzica, did you have public comment you'd like to give?
Yes. Can you hear me?
Yes, ma'am. Go ahead.
My name is Angela Panzica, and I'm a master's level social worker in Houston, Texas. I have been licensed since 2006. I also have a physical disability from birth, and I've spent the majority of my professional life working with people with disabilities and also people that are GLBTQ as well, because I also identify as part of that group. So first I want to say thank you for allowing me to give a comment. I also want to say I appreciate the fact that you guys worked so hard this morning to hopefully restore our current code of conduct to protect both people with disabilities and people that are of the GLBTQ community. I just implore you to continue to do whatever you can to make sure that that it sort of stays that way. I'm gonna echo sort of what everybody else has said, which is I'm concerned about you guys having to go back to the AG in order to get clearance. But you know, I appreciate your efforts so far and hope that they will continue. Thank you very much.
Thank you for time. Thank you for time to provide comments. We appreciate it.
Ms. Dean, did you have public comment you'd like to give?
Yes, my name actually is Jen Steenbergen. I'm an LMSW at the Ellis County Children's Advocacy Center in Waxahachie, Texas. I wanted to make a very, very brief comment to have it on the record. As social workers, some but not all of us are clinicians like LPCs, LMFTs, and psychologists. Where we differ from our peers is our code of conduct. The core of our identity and work is based on a systems model, person and environment. We recognize how the systems surrounding our clients play into their health and well-being. This ideology is so important that we have elevated the role of social justice to every fabric of our work. We are expected to advocate for all Texans, regardless of our personal feelings. It's not about us, but the most vulnerable of us. The discriminatory laws of the state of Texas are immoral, and a licensed social worker, we oppose them. We work to change discriminatory laws, not align ourselves with them. Thank you.
And will you tell us your name again? Or do we get a name? She's still on?
Sure.
It's Jen Steenbergen.
Would you mind spelling your last name for me?
Sure. Steenbergen.
Thank you very much.
Thank you.
Ms. Stone, did you have public comments you'd like to give?
Yes, I do. Thank you. My name is Margaret Stone, and I'm a registered nurse in Texas, and I'm speaking as an individual opposed to the discrimination that was reflected by the tentative October 12th rule changes, which are particularly offensive in a customer service profession. I felt the need to stand with social workers and mental health professionals in their objection to the October 12th rule change, not only because it's wrong, but I also fear this assault on equality of treatment could potentially move next to the nursing profession in an attempt to water down our rules as well. I appreciate your unanimous correction of the October 12th changes that you spoke of today. My understanding was that this change was made to align the rules across other Texas statutes already in place. But why do we feel the need to lower the bar when it comes to equality? Instead, this is our opportunity to upgrade and uplift Texas statutes, and I'm encouraged to see that we can count on people like Senator Menendez and Representative Gonzalez, among others, to fight along with us to press our other Texas legislators to do just that. To discriminate can only be a good thing if it allows you to see and appreciate a difference or make a distinction. Discrimination that then moves to act on that difference in order to deny providing service to others based on one's abilities, race, religion, color, national origin, sex, sexual identity, sexual orientation, gender identity, or sexual expression is unacceptable and has no place in a helping profession, or for that matter, our society as a whole. Thank you so much for your time and your allowing public input on this matter.
Thank you, Ms. Stone.
Ms. Falkenberg, did you have public comments you'd like to give?
Yes, sir. Can you hear me?
Yes, we can.
Great. Thank you. My name is Hannah Falkenberg. I'm in the Dallas area, but grew up in Houston. I've known Alyssa Karsagi for over 13 years. She was my babysitter for many years growing up, and I can speak personally to her character, her kindness and care for those around her, her diligence and responsibility with taking care of children, as I was raised partly under her care. I'm here today on behalf of her children and Miss Patrick's child, Shane, whom you heard from earlier, because I believe the safety of a child is worth fighting for. I'm here because I believe that you as an executive council have both the authority and desire to do the right thing by holding those who create flawed custody evaluations accountable. I'm calling on you to intervene and hold Dr. Arredondo responsible for the actions that she has taken that have put these children in danger. Alyssa's children tragically represent just 2 young lives who will be forever altered by a traumatic childhood of physical, emotional, and sexual abuse as a result of Dr. Kim Arredondo's involvement. Dr. Kim produced a biased report with false data that has put Alyssa's precious boys and many others in danger, trapping them in an endless cycle of domestic abuse. One might try to justify this particular incident as an unintentional mistake on Dr. Arredondo's part, except for the many other cases that she has been involved in, all of which have an eerily similar story of domestic abuse. Those stories cannot be ignored. You've already heard from Shane earlier today. In an evaluation with Dr. Arredondo, Shane was placed in the custody of his father. Shane has begged Dr. Arredondo to allow him to live with his mom where he was safe. Dr. Arredondo's report ignored his cries for help, trapping him in a living situation with his father where Shane says that terrible things have happened to him. You already heard about how his father had sex in front of him. Many other abuses have happened where he has not been given the nutritional support that he needs. And he is being prevented from being under the care of his mother who would care for him because of Dr. Arredondo's report. These people are helpless. They've tried calling CPS, they've tried other avenues to protect their children who they know are being abused, but because of Dr. Kim Arredondo's reports, they are unable to do anything about it. And that is why we are calling on you for your help and support in this matter where we see injustice happening.
30 seconds.
Thank you, Patrick. In Alyssa's case, Dr. Arredondo's license has allowed these children to be placed in the custody of a man who held a gun to his head in front of both Alyssa and her children. Dr. Arredondo is the reason these young boys are with their father, whose abuse is evident on their little bruised bodies every time Alyssa is allowed to see them. These children cry and beg not to go back to their abusive father. And despite the evidence of continued domestic abuse, Dr. Arredondo's license is continually cited as primary evidence that gives the process the power to continue putting these children in danger. I am here today asking that you seriously consider this case and do something about Dr. Kim Arredondo. Thank you so much for your time and for your service to the public.
Thank you, Ms. Falkenberg.
Ms. Rivka Fishman, do you have public comments you'd like to make?
I do. My name is Rivka Fishman. I have been a teacher for 20 years. I'm the author of a children's book on bullying, and I have known Alyssa since she's moved to Houston. She's a frequent guest at my home. As an educator and a bullying expert, I'm also a parent coach. There are a lot of adults who I do not trust to leave my children and my students around. I came on to state for the record that I trust Alyssa completely. She is an excellent influence on any child that she's around. She'll play a game with my children and their friends and encourage them to get along with each other and be good sports. There is nothing that I have ever seen from her that has raised any questions at all of whether or not she would be an excellent and safe mother for her children. There are a lot of people who I meet and I will not leave my children with them, even momentarily. And I absolutely trust her, would leave my children with her, and hope that justice is served. Thank you very much for your time.
Thank you, Mrs. Fishman. At this time, I don't believe we have any more public comments. Is that correct?
We need to check. I've got
Sure, I
one
see
caller
two.
here.
It just came up.
Caller, do you have any public comments you'd like to give? Okay, hearing none.
I see a few coming up and we are closing in on 5 o'clock. These last few that come up, let's please give them 2 minutes each. And then there's a matter I'd like to bring into closed session.
Okay. Ms. Cunningham, is there public comments you'd like to give?
2 minutes, please.
Sure. This is Tara Coronado again. I come every month. I've been coming to them since March of 2019. It's exhausting. I know you guys are exhausted. I feel for everything you're going through, the backlog and also the LGBTQ issues. But I'm going to keep coming, and it's heartbreaking to listen to Alyssa's, what's going on with Alyssa. I'm so happy to have all of that behind me. And had it not happened to me, I wouldn't believe that it can happen. It breaks my heart, all the people that are signing up to talk for her. And I have to say, at this point, I don't know if you guys are going to do anything. You're not processing complaints. There's high conflict. It's just very disappointing. And I think that it's wrong that we have to wait for outsized news entities to come and shine a light on the processes of domestic violence in family court and the use of these reports. They carry so much weight. I'm watching your faces as you listen to Alyssa's people, and I know it's hard to believe, but those reports carry so much weight and they're really difficult to turn around. You know, but for the University of Texas and some very important people that helped me, I don't know what would have happened. And so I really do want you guys to understand that there are a couple bad apples. It's not everybody. So if you could please start actively processing the complaints, and instead of saying, oh, these are just those high conflict cases, and maybe take a deeper look and realize the underlying issue is domestic violence. And I would love to see somebody on this board that has a background in domestic violence actually start taking a look at these cases that women are sitting for hours every month to tell you about. So I appreciate all that you do. I thank you for letting me speak. And I'm begging you to take a look at these cases that have underlying domestic violence issues. And that's all. Thank you so much.
Thank you, Ms. Coronado.
Mr. Camus, do you have public comments you'd like to make? Paul Camus or Camo? I'm not sure how to pronounce the last.
Come on.
Okay, hearing nothing. Ms. Silber, did you have public comments you would like to make?
Yes, please. I'll keep it short. I am
a community member where Alyssa Karsagi lives. And I can say with absolute love in my heart, she's a wonderful, amazing person. She's looked after my children. And I've had her as a guest in my home. My children love having her around. And if anything, I beg you to look into your hearts and help reunite her own children with her. She is an outstanding person, and I truly hope that this weighs in strong for her, because she definitely needs to be reunited with her children, and I see it as a complete disservice to two beautiful souls that are growing up without her.
Thank you, Ms. Silver.
Thank you.
Ms. Francis, did you have public comments you would like to make?
Yeah, I just wanted to introduce myself and tell you a little bit about my relationship with Alyssa. So I'm a social worker. I live in the community where Alyssa's been for the last, I don't know, about a year and a half. She's been to my house on several occasions, and she's watched after my kids, my children. I have 5 children, and she's watched after them on several occasions as well. On many of the occasions when she was at my house, it was together with me and the kids and my husband, and being a guest in our home. And she always interacted with my children really well. Nothing negative, nothing to say anything, just kind of positive, and telling them about herself, and giving my kids encouragement, and teaching my kids how to play baseball and stuff like that. And I just feel that it's very, very as a social worker, I feel that it's very difficult for me to see a mother who is without her kids. And I know that she has a lot of love to give, and I know that she will be successful in being able to raise her kids, well, if she's able to see them. And I really kind of want, I know from experience that there's a lot of kids out there that are in protective services, or not with their specific parent for one reason or the other. And at sometimes those situations have to happen. Yet I really don't think from watching Alyssa that this is kind of situation that it should be this way. And I just want to say that from my own experience, seeing her and seeing the way that, she gets along with the kids, and the way that she is, with the different kids of the community, how my kids really like hanging around with her, and appreciate her. And
Thank
I
you, Ms.
appreciate
Francis.
I
think you're out of time. At this time, I'd like to, I'm sorry, I didn't see Mr. Camo. After Mr. Camo, I'd like to call call us into closed session.
Mr. Camo, do you have public comments you would like to make?
Yes, can you hear me now?
Yes, go ahead.
Thank you. Of all professions, that of counseling should recognize the importance of integrating one's professional life with one's belief system and worldview. Even social workers risk their own psychological and emotional health to believe one thing and to do another. Inclusion of sexual orientation, gender identity, and expression language can itself affect discrimination against many licensed counselors. There needs to be an acceptable means by which a social worker is not penalized for refusing to take a case after initial assessment. Should there not be licensing available to counselors according to not only their specializations, but their belief system, social workers do, by which a client knows what to expect in a given counselor? The sheer number and nature of test providers today suggests there are many available LGBTQ-oriented clients. Note that the enumerated areas divide into 2 categories in the 202 thing. Those that are beyond one's control: age, gender, race, color, national origin, certain disabilities, and those, some controversially, within one's control or the other group. The latter category is potentially endless going forward. The social work philosophy, per Shelley Skeen, calls for advocacy of vulnerable groups. Does this not then mandate advocacy for continued gestation, live birth, and subsequent support of unborn children and their mothers by social workers? For Brenna Carabo testimony, reference to shaming, if it's really being done by social work, it should be addressed through channels. However, an abject disagreement as to the wisdom or practice of certain behaviors does not constitute shaming. And as for Mary Elizabeth Castle's testimony, the legislature has repeatedly rejected the type of language at issue in state law, and it should never have been included in the board's code of conduct in the first place. Please clarify these issues that are raised. Trying to bend over backwards and make it fair for certain groups makes it unfair to others.
Thank you. Thank you so much, Mr. Camo, and to all of our listeners today. The Executive Council will go into executive session at this time pursuant to the Texas Open Meetings Act in response to the Q&A remarks in order to bring new members up to speed on the high conflict case and our responses so far. The date is October 27th, 2020. It's 4:05 p.m. Patrick, I see you raising your hand.
Yes, please also cite to the particular provision. Is it to seek legal advice under section 5?
Yes, it's to seek legal advice and clarification. Thank you. Daryl, are you able to take us out into a private room, please?
I cannot. You're going to have to leave the meeting and log back in using that link.
That's what I meant. I'm sorry.
Yeah. Do I need to resend that link to everyone?
Yes, please.
Okay.
Thank you. Participants, if you'd like to remain on this channel, you're able to. We should be back shortly. Thank you.
Thank you.
Thank you so much. And thanks to our listeners for being patient with us. It's 4:29 p.m. on October 27th, 2020.
Hold on just one second, Madam Chair. We don't have a quorum here yet, so we can't call it to order yet.
Okay, where are we? We're 1, 2, 3, 4, 5, 6. There we go. Is that the quorum?
We do now? Yeah, I'm just kind of letting everybody get logged in.
Sure. Okay, I think we're ready.
We are ready.
It is 4:30 p.m. on October 27, 2020, and the Executive Council is now reconvened in open session. Thank you so much for your patience, listeners. And are there any other folks who want to speak? Here we go. Any other public comments? Sorry, my screen went dead. So what is the next item on the agenda? Is there anything that we'd like to put on the agenda for December the 4th? Is that the next meeting, Daryl, December 4th?
Yes, yes. No, I'm sorry. It's not the next meeting for council.
Oh, the next
I'm
committee
thinking
meeting.
that's the social work board's meeting.
Oh, okay, sorry.
Let's see here.
Any recommendations for the item for the next meeting? The only one that I took note of was a caller who asked about communication. I think it was Dr. All I remember is the last 3 letters of the name. Hold on. One who asked, Felderhoff?
Felderhoff,
Is that right?
Please.
Right. She asked about how the communications go out. Daryl, I know that you publish a notice of our agenda, and that agenda, does it usually have a draft of the minutes as well?
It does. It'll
From the
have
prior meeting?
Yes.
And
yeah.
This past meeting, the only exception was that one change from the governor's office because it came in so quickly.
Correct.
So listeners should know that they can get on our website or on the Secretary of State. Is that right?
It's on our website.
Why don't you tell us?
Yeah, I post the agenda and all the publicly available meeting materials on our website. Let me show you here.
And in terms, I think Dr. Felderhalf commented about the press as well, or the newspaper articles. That is outside our control. We responded to 2 that came directly to us. No others that I'm aware of came to me, to Daryl, or to any other member of the board of the council. Is that correct, Daryl?
Well, there were several that came to me alone, and I had to direct those over to the governor's press office.
Got it. There were 2 that came to me alone, and I directed them to the governor's office and added a little sentence or 2 of my own. I don't think I was quoted. So if you're hearing things from the press, you should probably take that with a grain of salt. If you would like to know what the official response is, then we're a council under the, I guess, authority of the executive branch, and it's the governor's office who would be responding. Is that correct, Patrick?
Yes.
Yes, correct, Daryl?
Yes, ma'am.
Okay, and I think that addresses Dr. Felderhoff's concerns.
Yes, and up on the screen, you'll see, this is the web page we have on the council where we list all the council meeting dates. You can see today's meeting date is up here. I put both the agenda and the publicly available meeting materials are available for download well in advance of the meeting. So that's where you can find, there's a high probability that everything you're looking at, that a council member is looking at, is in that package. There's a few things I can't make public. Certain disciplinary enforcement type functions I can't make public, but for the most part, it's all publicly available information.
Thank you. Anybody else have an item that they'd care to add for the next council meeting in January? Then at that meeting is when we'll discuss whether we meet public in person or on Zoom.
Yes, ma'am. Earlier, I think I had mentioned December because I was mixed
Yes.
up about the LPC board meeting, but it would
Thank
be
you.
January is our next meeting date, January 12th.
Thank you.
So
So is I.
that's when we'll talk about whether or not to resume in-person meetings.
Then anyone else? Comments, questions, or concerns? Then I'd like to thank everyone for attending. Go ahead,
I just
Dr. Fletcher.
wanted to make a comment. Thank you to the new board members. And this is, a longer meeting than we typically have, but I just want to acknowledge that, again, that we have new board members and how much I appreciate that.
Thank you. I was just about to do the same and you've done it for me. So thanks so much. And thanks to all of you who spent the day listening to us and who, even whether we agree or don't agree, you are our partners, you are our voices, and we appreciate your sharing your thoughts with us. They never go unnoticed. And I'm looking at the chat box like I can, looking at a person. I'm looking at the camera now. Thank you all so much for everything you did. Had it not been for you, I don't think the social work issue would have been addressed as well as it has and as thoroughly as it has. We really do appreciate you. And thanks to our staff and the rest of our council members. And I hope January the 12th is much more uplifting. Do I hear a call for adjournment? Motion to adjourn?
Motion to adjourn. I make that motion.
Oh, sorry, I didn't hear you. Second?
Second.
Can't second. Okay, 3 seconds. And thank you all for a productive meeting. Bye-bye.
Thank you all.